Agenda today. On the next slide, you'll see we sort of have three main discussion items that we're very excited about. So first, we will be joined by our research partners from the UC Berkeley Turner Center to provide highlights from the statewide homelessness assessment, which we will then use to inform our discussion of priorities for the Cal ICH State Funding and Programs Working Group. We will also discuss our recent fiscal year 21-22 action plan progress report and the next steps for updating that plan. For this agenda item, we've invited members of our advisory committee to provide context on their meeting earlier this month, where they learned about the action plan and provided feedback on its implementation. And lastly, we've invited our federal partners from the U.S. Interagency Council on Homelessness to present on the federal strategic plan all in. Can we go to the next slide, please? Great. So that's the agenda here. You know, as always, the materials for this meeting have been posted to our webpage ahead of today. And as you can see, since there are a lot of important topics to get to today, we want to make sure each gets its due time. So we will be working hard to stick to our estimated schedule for each agenda item. So thank you for your patience and your flexibility as we go through this meeting. All right, so with that and this full agenda, let's get the meeting started. The California Interagency Council on Homelessness is hereby called to order on this day, February 27th, 2023 at 1:06 p.m. Will Cal ICH staff member Giselle Sanchez please call the roll?
Yes, I will. As I call your name, please say here or present. Secretary Lourdes Castro Ramirez.
Present.
Secretary Mark Galley.
Good afternoon, present.
Tomas Aragon.
Present.
Stephanie Clendenin.
Present.
JC Cooper.
Present.
Susan Damaris.
Present.
Vito Imbasiani.
Assistant Deputy Secretary Roberto Herrera in today for Vito and Blasiani. Thank you.
Thank you. Kim Johnson.
Present.
Tina Johnson Hall.
Present.
Veronica Lewis.
Present.
Jeff McCumber.
Present.
William McGee.
Present.
Tamika Moss.
Present.
Tim Rainey. Nancy Robles.
Present.
Rebecca Ruan O'Shaughnessy. Tony Tavares.
This is Elisa Becerra in for Director Tavares.
Thank
Present.
you. Thank you. Gustavo Velasquez.
Present.
Nancy Ward.
Present.
And Joe Xavier.
Present.
Thank you all. We have majority of members present. We could continue with this meeting.
Great, thank you, Giselle. Before we move to our next agenda item, I just have a few logistics to go over to help our conversation run smoothly today. I would like to first welcome and remind all members of the public that we take public comment after each action item listed on the agenda and at the end of each meeting. To ensure everyone is given a chance to speak who would like to, we would allow for a maximum of 2 minutes for each comment. We welcome all public comments and feedback. However, due to the structure of this public meeting, we're unable to respond to them. For this reason, if you have any specific questions that you would like answered, we ask you to please email us at calich@bcsh.ca.gov. All right, I will now turn to our co-chairs, starting with Chair Secretary Castro Ramirez for her opening remarks.
Great. Thank you so much, Cody and Giselle. Thank you for pulling us together. As Cody mentioned, we do have a robust agenda and a lot to discuss, both in terms of the progress that we're making as a council, but a lot to discuss as it relates to the landscape assessment and also the work at the federal level through the U.S. Interagency Council on Homelessness. As we begin our second year together as a council, I want to just take a moment to thank each of you for your commitment and to acknowledge the collective progress that we are making and continuing to make into the future with our action plan and with the programs and the policies that we're implementing across state government. Addressing homelessness continues to be at the forefront of the governor's priorities. And as co-chair of this council, I'm energized to build on our momentum as we answer the call from the governor, from the legislature, and from Californians who are serving and supporting every single day. This body is a critical expression of the governor's all-of-government approach. We know that it takes all of us working together across agencies and departments to serve unhoused Californians in an intentional and person-centered way, while also staying focused on how important it is that we remove structural barriers to prevent homelessness, and also staying focused on investing in housing solutions that will help people move into homes with the support that is necessary to ensure that they're able to thrive in their chosen communities. Today, as mentioned by Cody, the Turner Center will be joining us to provide an overview of the statewide landscape assessment. It should be included in your packet. It's very extensive and just a really great report that reflects what the state has been doing and how we have been responding as we address homelessness for the last 3 years, from 2018 to 2021. Impressively, you'll see that over the last 3 years, the report finds that state and local communities have collectively served almost 600,000 Californians. The assessment also provides some valuable insights as we continue to refine our action plan and as we continue to stay grounded and focused on improving outcomes for unhoused Californians. We've also, of course, seen some very positive results across our various departments and agencies in the housing and services space. Projects like the Project Room Key, the Home Key Initiative, and the HAP program. I think I don't need to say this again, but I'll share it. Home Key alone has led to the creation of almost 13,000 short and long-term homes. So we're making good progress, but we also know that much more needs to be done to reduce housing insecurity, to decrease unsheltered homelessness, and to increase permanent housing. We need to be also humble and constructive and critical in assessing what's working and what's not. We need to stay focused on scaling successful, innovative, and equity-driven solutions. And we need to also continue to advocate for more funding for evidence-based programs, more funding at the federal level as well for programs like the Federal Housing Voucher Program, as we continue to bring an all-of-government approach to ensure that every California has a safe and stable place to call home. I'm also mindful that we need to lean in more in terms of how homelessness prevention with a focus on equity and addressing also the structural factors that tend to create situations that force people into vulnerable, having to make decisions or having to be forced into vulnerable situations. So we must ensure that our agencies and systems are helping people stay housed. We must ensure that people that are exiting institutional settings have access to stable, affordable housing, and that residents that live in underserved and extremely low-income areas, which too often are, these areas too often are places that have higher concentrations of Latino, African Americans, or indigenous communities. We need to ensure that we're also investing in these communities and making them communities where people are able to live and thrive. As we continue to move together, as the governor has said, we also need to remain focused on measuring our work and increasing accountability. And accountability is accountability at the state level, but also it's accountability for the investments that we're making at the local level. The statewide action plan has been a great tool, so we'll be spending some time today taking a look at our joint commitments and the progress that we are making to implement the action plan. There's a lot. There's a lot to be proud of as you read the latest annual update. It's very rich with a lot of good information. And it also, lends itself, especially given the conversation that we will be having with USICH, it allows for us to be able to be more strategic in terms of the level of support and resources that we will need from our federal partners. And then last but not least, I just want to again sort of acknowledge the important role that the advisory committee has in helping to shape this council, helping to inform our priorities, and also acknowledge and thank our council members, Veronica Lewis and Tamika Moss. Thank you for your local expertise, your on-the-ground perspective, your ongoing feedback in terms of the overall work of the council, but also in terms of keeping us focused on moving these systems that are designed to help prevent and end homelessness. And so with that, I'm excited also. Helene, thank you for joining us today. I'm excited to hear more about the federal all-in plan. As Cody mentioned, this is a plan that was released by the Biden-Harris administration in December of last year. It is a plan that will bring 19 federal agencies together to support communities across the United States as we continue to move the needle in terms of addressing homelessness. And so I'm excited, Helene, for the robust conversation that we hope to have. So with that, I'd like to now turn things over to my co-chair, my colleague, Dr. Mark Galley. I don't see you on my screen, but I know
I'm here.
you're
I'm here.
There we
Thanks.
go.
Yeah.
Good to be with you.
Secretary Castro Ramirez Lourdes, thank you for the comprehensive introduction to today's meeting. I'll just add a few things. First, really excited to welcome Nancy and Jeff to the team, to this effort. I know each of your agencies has an enormous level of investment and commitment to the issues of Cal-ICH. And I've enjoyed working with you all on these issues already in your short time. And Jeff, just excited to continue connecting with you and the work that DHCS is doing with CDCR on some of the really important justice-focused Medi-Cal innovations that the federal government just recently approved to help us support not just in the prison system, but in local jails and juvenile detention facilities as well, services to individuals that we didn't have the chance to provide previously, and this opportunity to connect not just some of the health and behavioral health issues, but the housing and homelessness issues of individuals who are currently incarcerated, but returning to communities soon. I think it's exciting, and Jeff, look forward to working with you on those issues. So welcome to this team on behalf of both Lourdes and I. We're excited to have you. Second issue, I just wanted to spend a minute on accountability. Lourdes, I'm glad you raised it. Anybody who listened to this the governor's budget presentation heard loud and clear from the governor his focus on accountability. We've been, even since the end of last year, talking about what does accountability look like as it relates to state funding that is related to homelessness. We've had a lot of really spirited, good conversation with local partners to push the envelope to figure out what that looks like. How do we not just talk about how short we are on the money, but how we can be more creative, coordinated, and working together on some of the solutions. And I think, Lourdes, you said it well, this interagency council is a key part of that accountability structure. It's not just how do we make sure that local dollars are accountable, but also our state efforts. And there's a lot in the landscape assessment, the action plan that we can be proud of and that we can use to be focused on accountability moving forward. So the same challenges that go out to the local partners, I think, come across to all of us as not just interagency council, but really an interconnected council of people working together at the state level to advance programs and policies that really make ending homelessness in California a little closer at hand than it was the day before. So what does accountability look like? For me, it's really thinking about how accountability, not for the sake of reporting a new dashboard or a shiny, glossy report, but really how does accountability push us to make sure we're doing 4 things? One is prioritizing the populations that for so long have been experiencing homelessness and really working to make sure we're addressing their needs. Accountability helps us make sure that we're tracking towards the goals that we set in those prioritizations. Secondly, coordination. I think there's some important efforts that we've talked about in prior meetings around coordination of efforts across our state family that has direct relationship to coordination at the local level. How do we use our focus on holding each other and ourselves accountable to make sure we're elevating prioritization? Third is outcomes. Obviously, we want to make sure that the significant investments in money and coordination efforts are actually driving the outcomes we want to see, which, put it plainly, are fewer Californians sleeping unsheltered on the streets and more people housed in permanent housing. And then fourth, equity. We know that just because you're making achievements in your bottom line outcomes doesn't mean that we're closing some of the significant disparities and the longstanding inequities in homelessness experiences, especially among Blacks and African Americans in California and other groups where the clear disparity, it's not new, it's not recently discovered, it's longstanding, and our focus on accountability can address those disparities as well. So I'm looking forward to sort of rolling up our sleeves and understanding, even in today's agenda items, how we can think about accountability differently, hold ourselves more accountable than we had before, and really work towards what the governor has laid out is that we really understand how these enormous investments in time, money, and energy are really coming together to improve the situations in our communities. I'll just highlight a few last things that really about things within our agency that we are working on. One is just last week, I think it was on Wednesday, DHCS announced the first round over $900 million going out for the Behavioral Health Bridge Housing Program. This is a program that after a couple years ago, we put out nearly $3 billion in infrastructure funding that, when you put out that level of investment in infrastructure, it takes time to build it up. The Behavioral Health Bridge Housing Program was conceived last budget in order to allow immediate funding for placements for individuals experiencing homelessness with severe and disabling behavioral health conditions. In the last homeless count, we noticed from 2018 to 2022 that we've seen a nearly 23% increase in that population. Nearly 40,000 Californians who were counted as part of the point in time count report having severe behavioral health condition. So this behavioral health bridge housing opportunity becomes a local investment in immediate solutions for those individuals, and we hope to see the fruits of that effort pretty immediately. And then the second thing, last week, or maybe it was the week before last, we held the first Care Court Work Group Advisory Committee. Many of you have been tracking what the governor and the state is doing as it relates to CARE Act implementation. And in this first working group, the focus, again, not surprising, was housing and homelessness, and how CARE Act and its promise to bring treatment and services and housing together. We have to continue to work to crack the nut of where is the housing and how is it going to be made available? So I was proud to see that being the first issue tackled by this group, and I'm sure it will be one of ongoing conversation. So again, I raise those things here because I see this group and this agency holding, this council holding my agency accountable for delivering on the promises of both Behavioral Health Bridge Housing, CARE Act, and many other things. And I look forward to today's conversation and just welcome you all. So Cody, with that, I'll turn it back to you. Thank you.
Great. Thank you both so much. Appreciate that. I will now pass it to Giselle to facilitate the approval of the consent calendar.
All right. This is agenda item 4, the consent calendar. The consent calendar is for regular or non-controversial items that need to be approved by the council, where we don't expect any discussion from the council. That said, the council may engage in discussion on any items on the consent calendar if members so choose. We have one item, the adoption of the November 10th council meeting summary. Are there any comments from council members? All right. Before proceeding, since this is an agenda item, we will now accept public comment. Please keep comments to items on the consent calendar only. If your comment is not related to the consent calendar, there'll be time for a general public comment at the end of this meeting. If you're connected through Zoom, please select the raise hand icon in the meeting window of your computer, and I'll allow you to make your comment. For those connecting or joining us by phone, you may press *9 to indicate that you'd like to comment. Once I call on you to speak, you'll be instructed to unmute yourself. And then you will have 2 minutes to make your comment. Just gonna give it a second, see if we have any hands raised. Okay, I'm not seeing any hands raised, so we will move on to a vote. Would anybody like to motion to approve?
This is Councilmember Lewis. I'll move to approve.
Thank you. And then we also need
I'll second that motion. Susan DeMorris.
perfect. Thank you. All right, we have a motion to approve and a second. I will call the roll. Please say aye or nay, and you may also abstain from voting. All right, co-chair Lourdes Castro Ramirez,
Aye.
co-chair Mark Galley,
Aye.
Tomas Aragon,
Aye.
Stephanie Clendenin,
Aye.
JC Cooper,
Aye.
Susan DeMorris,
Aye.
Roberto Herrera,
Aye.
Kim Johnson,
Aye.
Tina Johnson Hall,
Aye.
Veronica Lewis,
Aye.
Jeff McComber,
I will abstain since I was not at the last meeting.
great. William McGee,
I'll also abstain. I was not at the last meeting.
all right. Tamika Moss,
Aye.
Tim Rainey, if you were present. All right, Nancy Robles,
Aye.
Rebecca Ruan O'Shaughnessy, I believe you have joined.
Aye.
Thank you. Elisa Becerra,
I abstain.
Gustavo Velasquez,
Aye.
Nancy Ward,
I'll abstain. I wasn't at the last meeting either.
and Joe Xavier.
Aye.
Thank you. We do have a quorum of members approving, so this motion has passed. All right, we could continue with this meeting. We will now move to agenda item 4, the proposed homelessness investments for the FY 23-24 budget. I'm going to pass it to Dr. Chico Rick Brema and our Deputy Secretary of Homelessness, and Corinne Buchanan, Deputy Secretary of Policy and Strategic Planning, for an overview of these homelessness investments, or in the January budget proposal.
Thank you, Giselle. Thank you very much. Just a very quick overview from me and Corinne on the homeless and housing and human services investments. So as you may have heard a little bit from the co-chairs, in the January 10th budget, the governor is continuing to invest in the Homeless Housing Assistance and Prevention, also called HAP program. That program provides flexible one-time 5-year funding, which is available to California's 58 counties, all 44 continuum of care entities in the state, and the big cities, and allows them to support their efforts to build capacity at the local level, strengthen systems, and prevent and address homelessness. As committed previously, the governor's proposed budget includes investing $1 billion for a 5th round of HAP grants. And in tandem with these flexible HAP funds, and again as committed previously, the administration is continuing to provide local communities with targeted funds to help people living in unsheltered situations by investing an additional $400 million in a 3rd round of encampment resolution grants. This 3rd round follows $50 million in round 1 and $300 million in round 2 of grants to help people living in encampments, and these previous rounds already allocated funds to 26 communities across the state. Both co-chairs mentioned their very intentional focus on cross-sector collaboration, both at the local and state levels, because we want to ensure that housing, homelessness, health and human services, as well as all the other portfolios reflected on this Interagency Council, are working together to integrate forces and serve Californians in a very person-centered, equity-focused way. As you can imagine, cross-sector collaboration and regional coordination is also top of mind for the administration, which proposes to work with the legislature this year to advance accountability legislation to further strengthen systems at the local level and enhance the availability of housing throughout California, housing that is affordable and available to extremely low-income and low-income households. The administration intends to pursue statutory changes to prioritize state spending on activities such as home key operating sustainability and Community Assistance Recovery and Empowerment Act housing supports. This focus may also be accompanied by expanded housing streamlining provisions. So there's more to come on all of those things that I mentioned. Now I'll hand it over to my colleague at the Health and Human Services Agencies, Deputy Secretary for Policy and Strategic Planning, Corinne Buchanan, who will provide more details on investments at that agency for people with complex medical and behavioral health needs.
Thanks so much, Dakshika. Hi, folks. Corinne Buchanan here with the California Health and Human Services Agency. So building on previous years, the focus of this year's budget investments at Cal HHS around homelessness are on people with complex behavioral health conditions and an effort to leverage Medicaid to support our housing efforts, specifically on rental payments. And this is really about making good on our commitment to the connection between housing and health, and seeing them really as one whole. So though this isn't a homelessness funding stream, the first item I'll lift up, since the Secretary mentioned it in his opening remarks, is the CARE Act, which creates a new pathway to deliver behavioral health services to the most severely impaired Californians, who too often are suffering in homelessness or incarceration without access to treatment. So the CARE Act is really about moving that care and support upstream and providing the most vulnerable Californians with access to those critical behavioral health services. And because many of those served by the CARE Act may be experiencing homelessness, as we've talked about, ensuring that housing as a part of the care plan is really baked into the model. There are 7 counties that'll begin serving individuals by October of this year, with Los Angeles announcing recently that they'll be joining by December of 2023, and the remaining counties launching by December of 2024. Funding to be able to support the startup costs for counties and courts was included in the 2022 budget, but this year's budget includes funding for county costs, the courts, and legal representation, all subject to ongoing refinement that is happening as we speak. The next item I'll lift up is the Behavioral Health Bridge Housing Program, which provides $1.5 billion in funding administered by the Department of Health Care Services to counties, as was described previously, to get at and address the immediate housing needs of people experiencing homelessness who have serious behavioral health conditions. And doing this by providing housing through 1, through interim housing, 2, through rental subsidies, and 3, through board and care settings. these funds will also be prioritized for those individuals who will be engaged through the CARE Act. And as you heard last week, the RFA for almost $1 billion in the first round of funding was released. And look forward to working with many of their county partners who may be listening in on the implementation of those resources. For this program, the January budget does delay $250 million in general fund of that total $1.5 billion from 2023, moving it instead into 24-25 through a delay. On the California Department of Social Services side, the Housing and Homelessness Division implements 7 housing and homelessness programs that are embedded in the social services delivery system with significant one-time program expansion dollars that totaled over $2 billion, which were invested in the budget acts of 21 and 22. We've gotten questions about this, so I want to clarify that there are no cuts or changes to the CDSS housing and homelessness programs in the proposed 23-24 budget. And additionally, all of the prior one-time investments from those previous budget years do have multi-year spending authority to ensure that grantees can commit to these longer-term supports for individuals and families who are enrolled in these programs. So next, I want to highlight 2 opportunities that will be supporting rental payments, which we know are absolutely key to our work via Medicaid through waivers. These will require federal approval, but we continue to push the envelope on leveraging federal funds in our efforts here in California to address homelessness. So the first opportunity is the CalAIM Transitional Rent Waiver Amendment. And for this one, in order to improve the well-being and health outcomes of Medi-Cal members during critical transitions, our Department of Healthcare Services will seek an amendment to the CalAIM waiver to authorize an additional community support for use by Medi-Cal managed care plans. The new community support would pay for 6 months of rent or temporary housing to eligible individuals experiencing or at risk of homelessness and transitioning out of institutional levels of care, correctional facilities, or the foster care system, who are at risk for inpatient hospitalization or emergency department visits. This year's budget includes $17.9 million, increasing up to just over $116 million per year at full implementation. And then the second opportunity under our Medicaid program is the California Behavioral Health Continuum, Community-Based Continuum Waiver, which is an 1115 demonstration waiver that's also being pursued by the Department of Healthcare Services. And this waiver would expand behavioral health services for Medi-Cal beneficiaries who are living with serious mental illness and serious emotional disturbance, with a focus on youth, people experiencing homelessness, and other justice-involved individuals. Among the many other goals that I do not have time to get into today, the waiver would allow for counties to cover rent or temporary housing for up to 6 months for certain high-need beneficiaries, as well as supportive employment to help address critical needs for the treatment and recovery of individuals who are living with serious behavioral health conditions. And with that, we have summarized some of the important highlights of the Budget Act, the proposed budget, and I will now pass the baton back to Cody.
Great, thank you both for that. So we're going to move to the next agenda item, item 5 here. So I'm really excited to get into this next discussion. As many of you know, CalICH recently completed a statewide assessment of homelessness programs funded or administered by the state, as mandated by AB 140. This assessment is publicly available on our website and contains really rich information on the funding allocated, population served, and outcomes from these programs. For today's agenda, we've invited our research partners from the UC Berkeley Turner Center for Housing Innovation to come present on some of the key findings from this assessment and to answer some questions from council members. After this presentation, we've invited one of the co-chairs of the CalICH State Funding and Programs Working Group, Hannah Azamati, to discuss that group's priorities and lead council members in a discussion on how to use the lessons from the assessment that we're hearing about to guide that group's work. So now, without further ado, I will hand it over to my colleague Ryan Finnegan, Senior Research Associate for the Turner Center, for a brief presentation on this assessment. Ryan, take it away.
Thank you, Cody, and thank you all for the opportunity to highlight some of the findings from the homelessness landscape assessment with you all today. Like Cody mentioned, this assessment was a collaborative effort between CalICH staff, the Turner Center for Housing Innovation, Apt Associates, and UCSF's Benioff Homelessness and Housing Initiative. The next slide, please. The Homelessness Landscape Assessment is a snapshot of programs designed to address homelessness over the course of a 3-year fiscal year period, which spanned July 1st, 2018 through June 30th, 2021. And this recently released report to the legislature responded to AB 140, which asked for information on several questions, including how much state administered funding was allocated to address homelessness and how those funds were used, who was served by these landscape assessment programs, what types of services were provided, how much temporary and permanent housing was created, and what were the outcomes for people who received this assistance. Next slide, please. The report to the legislature presents quantitative findings addressing these questions, and these findings come from several sources. Most notably, the report analyzes data from Cal ICH's Homelessness Data Integration System, which synthesizes data from local homelessness services, shelter, and housing programs. The HDIS provides the state's most comprehensive data on services provided by homelessness programs, how many people they serve, their characteristics, and their outcomes. The breadth and the quality of HDIS data are also improving over time. Local providers typically submit data when required to by federal or state funding, and AB 977, which is recently enacted, expands this list of state programs that will require such data reporting. The report also draws on several other data sources, including a survey of state departments and agencies that collected information on the funding allocated to state administered homelessness programs and the intended uses of those funds. And then various other published documents and data supplemented information on the services, shelter, and housing provided or created during this assessment period. And then the next slide, please. So in coordination with state agencies and departments, Cal ICH staff identified 35 state administered programs designed to address homelessness. These programs were administered by 9 different state agencies and departments, and they were allocated $9.6 billion throughout the reporting period, which includes both funding provided by the state and federal funding administered by state agencies or departments. As shown by this chart, the total amount of funding for programs increased between fiscal years. The largest share of this funding was $5.5 billion dedicated for affordable housing production, including units set aside for people experiencing homelessness. Other intended uses for this funding includes creating and operating interim housing programs, operating permanent housing programs, and providing housing subsidies, as well as homelessness prevention. It's also important to note that these state-directed investments helped local homelessness services programs leverage other sources of federal and state funding for providing services, shelter, and housing. Next slide, please. Throughout the reporting period, over 571,000 people were served by programs that report to HDIS. And then as shown in this chart, the total number of people served in each fiscal year increased with time, reflecting the system's growing reach into the community. The total number of people served throughout the reporting period doesn't completely match up with adding the number in each fiscal year because many people were served across multiple fiscal years. Approximately 273,000 people were ever served by interventions supported by one of the 35 state programs included in the landscape assessment, which is almost half of the total population served throughout this period. This fraction, which is represented by the dark blue bars in the chart, also increased in each consecutive fiscal year of the assessment. Most of the people served throughout this period were adult individuals, meaning that they were not in families with children, and most of these people were at least 25 years old. However, almost 1 in 4 people served throughout the period were children younger than 18 years old. Also notable among the population served, nearly 2/3 were newly experiencing homelessness, defined by having no recorded use of homelessness services, shelter, or housing in HDIS in the previous 2 years. And approximately 20% of people experienced chronic homelessness throughout the period, which is defined as experiencing homelessness for at least a year over the course of 3 years while living with a serious mental illness, substance use issue, or physical disability. This fraction was highest for adult individuals 50 years old or older, about 40% of whom experienced chronic homelessness. Next slide, please. So this chart shows the percentage of the population served by homelessness programs in each racial and ethnic group, reflecting the longstanding racial and ethnic disparities that Secretary Galley brought up in terms of who experiences homelessness. We see that Black people, Native Americans, Native Hawaiians, or Pacific Islanders all make up a larger fraction of the population served by homelessness programs compared to their representation in the state's overall population. In 2020, Black people comprised 6% of California's overall population, but 31% of people experiencing homelessness and 28% of people served by homelessness programs. Among the population served by homelessness programs, people of color were served in families with children more often than non-Hispanic white people, as shown by the differences in the lengths of these dark blue bars. Half of Hispanic white and 39% of Black people served by homelessness programs were in families with children, compared to 21% of non-Hispanic white people. Adults at least 50 years old were most represented among non-Hispanic white people. 38% of non-Hispanic white people served were older adult individuals. Next slide, please. The HDIS included more than 1.1 million enrollments in homelessness programs for those 571,000 unique people served throughout the 3-year period. As shown in this table, these service enrollments were most commonly including stays in emergency shelters, interactions with street outreach teams, and rapid rehousing assistance, which provides temporary subsidies to people to quickly move them back into housing. These kinds of services also differed by household type. Emergency shelter and street outreach programs most commonly served adult individuals, while rapid rehousing and homelessness prevention programs mainly served families. Most people were also only enrolled in a single program throughout the 3-year reporting period, and only a small fraction, less than 5% of the population served, was enrolled in 5 or more programs throughout the period. Next slide, please. This chart shows the number of units or beds of each type of interim or permanent housing in California over the course of time. And both permanent and interim housing supply expanded during the reporting period, which is highlighted in blue. Between 2018 and 2021, the state added more than 17,000 emergency shelter beds, partly supported by Project Room Key, which rented hotel rooms during the pandemic to safely shelter people experiencing homelessness, and Home Key, which provides localities with funding to acquire and convert underutilized properties, including hotels and motels, into both interim and permanent supportive housing. Although Project Room Key is winding down throughout much of the state, much of this increase in interim housing during the reporting period was supported by other programs aside from Room Key, and that expansion will last beyond the pandemic response. Over $5.5 billion of the total $9.6 billion of state administered funding was directed at 8 programs that are specifically designed to facilitate the production or acquisition and rehabilitation of subsidized units. And these investments are projected to produce or preserve over 58,000 units of affordable housing in the coming years, including more than 10,000 of which are set aside for people experiencing homelessness or people most at risk of becoming unhoused. And the next slide, please. And then finally, the assessment measured people's outcomes by the services that they were receiving at the end of the reporting period, so on June 30th, 2021, or by their last known living situation as recorded by staff of local homelessness programs. Almost 170,000 people were still enrolled in programs at the end of the reporting period, as shown on the left. This group included 55,000 people who were living in permanent housing programs, as well as another 50,000 people who were enrolled in these programs but had yet to be moved into a housing placement. Almost 39,000 people were staying in interim housing on June 30th, 2021. Then, as shown on the right, there were over 402,000 people who were served by homelessness programs during the reporting period and were no longer being served at the end of that period. Program staff recorded almost 133,000 people as moved into permanent housing without a subsidy. That can include people who moved in with friends or family, as well as people who moved into their own permanent housing. Almost 41,000 people had moved into housing with either a temporary or long-term subsidy. However, 57,000 people were recorded as continuing to experience homelessness after exiting all programs during the period, most of whom exited to unsheltered situations. Finally, there is no information recorded as the outcome for 141,000 people who had exited all programs by the end of the reporting period, which comprised almost 1/4 of the entire population served. These unknown outcomes could reflect positive outcomes, including people moving into permanent housing who no longer need assistance from homelessness programs and thus had no further contact with program staff. However, these outcomes were also most common for people who exited street outreach and emergency shelter programs, many of whom may have continued experiencing homelessness. So in summary, the report to the legislature documented that the state directed $9.6 billion to 35 programs designed to address homelessness. These state programs supported interventions that served at least 273,000 people throughout the 3-year reporting period, and more than 571,000 people were served by the system overall. These landscape assessment programs also contributed to expansions in both interim and permanent housing supply, as well as supportive services for people exiting, experiencing, or at risk of homelessness. Finally, it's also important to note that it may be too early to fully realize the impact of all investments made in fiscal years 2018 through 2020. There are often lags between the times that funds are appropriated, when those funds are spent locally, and when outcomes are possible to measure. Housing and shelter take time to build, and programs take time to hire and train staff, particularly while navigating the disruptions caused by the COVID-19 pandemic that occurred throughout this 3-year reporting period. The report also provides the first in-depth analysis of Cal ICH's HDIS data to monitor the services and outcomes for all people served by programs within California that participate in this data system. The quality of the HDIS data has improved and will continue improving with time, and future analyses can continue to monitor who is served by homelessness programs and their outcomes statewide. And so thank you all for the opportunity to share these findings with you, and I look forward to answering any questions that you might have.
Great, thank you, Ryan. Really appreciate that presentation. And thank you to your whole team and all of the research partners who helped. This really was a group effort and could not have done it without your work. So really appreciate that. And now we have time just for 1 or 2 questions from our council members, specifically about the findings Ryan just presented. A reminder that we still have another part of this agenda item to go through. So we may not have time for every question, but can always follow up afterward if needed. So for council members, any questions specific to clarifying the presentation that just happened? I see William.
Great. Thank you, Cody. And hello, everyone. My name is William McGee. I'm with the California Department of Education, and thank you for the presentation, Ryan. One of the things that my team and I looked at, and my team had flagged a couple of things, is a question about how are students included in these services? There seem to be services for families and for youth 18 to 24 years old. And so how are children who are younger, elementary school age, middle school age, included in these services?
So great question. And this is one of the areas where there are parallel sources of information about the services provided to people depending on the system through which they entered services. So the services provided here for families would be for folks entering through what we might think of as the mainstream homelessness services systems within localities, which not only are administered differently than services for public school students, but also define homelessness differently. So in one of the final sections of the report, I think you only have to get through like 150 pages to get to it. So it's really close to the beginning. There's a section that specifically outlines differences between the public school system addressing homelessness and the mainstream homelessness services. The distinction here is that the elementary school system services are often not required to participate in HDIS, and so they're not going to be reflected in some of the numbers that we present here, although it depends on the provider, whether they're going to be participating in the system or not. The other difference is that the public school system data includes children who are living doubled up, whereas many of the services that are included in this assessment, although not all, focus on people experiencing literal homelessness, meaning staying in emergency shelters, temporary housing, or in situations not meant for human habitation. So there are a couple of ways in which there are some differences between what the public school system focuses on and how they serve people, and then what is recorded in the data used for this assessment.
Great, thank you. Tamika?
Thank you, Cody, and thank you, Ryan, for the presentation. I just had a sort of question and comment about the production numbers that the state funding is producing. And I believe you referred to 58,000 units of affordable housing, and about 10,000 of those units are set aside for extremely low income households. And I'm just curious about how do we think about increasing that number, given that just for the Bay Area over the next 8 years, we need at least 58,000 units of ELI housing to start to address the disinvestment in deeply affordable housing in the region. So I just want to flag that I think that number is super low, and how do we think about programs like Home Key and Room Key that the secretaries talked about have long-term sustainability, so that not just in funding, but in terms of bringing those units on to the market faster. I loved that during the research period, there was an increase in interim and permanent housing. We completely endorse that and want to see more of it. So just wanting to flag that if we're thinking about scale, we have to do a better job there.
Mika, if I may, I just wanted to chime in. I don't see Director Velasquez on my screen, but he may also want to chime in, but completely agree with that point. I don't think that this, three-year snapshot covers projects that have been funded since then or projects that are in construction. And so we are following up with HED to ensure that we're capturing the scope of the state's investments, both in terms of preserving units that are affordable, and also in terms of creating new units. Just to sort of taking a step back, the state's housing assessment, or the state's housing plan, calls for the creation of 1 million new units of affordable housing by the communities need to plan 1 million new units of affordable housing between now and 2030. And so cities and local jurisdictions have robust housing goals to get to, and to be able to do that it really requires also that we continue looking at how we're leveraging not just state dollars and local dollars, but also how we're leveraging federal funding, including rental subsidy assistance, to ensure the long-term viability of those units. So agree. I just wanted to point that I don't think it captures everything, that the report does not capture everything that's in the pipeline currently.
And I'm sorry, I'm off camera, I'm driving. This is Gustavo Velasquez from HCD. The secretary is correct. And also, I believe the assessment encompasses the state subsidized units. We have information on a lot more units being created by local funding and other types of local subsidies. So that could be also why the number is much smaller than what it should be.
I'll just say that's correct on both fronts. So the 3-year fiscal year reporting periods, we haven't captured anything since June 30th, 2021. So for example, Home Key 1 is included in the landscape assessment, but not Home Key 2. And Director Velasquez is also correct that these are units that include funding from state administered programs, but housing built with local sources and just federal sources that are not state administered would not be included in that count.
All right, thank you all. So for the sake of time, I'm gonna pause us on questions on this for now. We will have a chance to have discussion after the next presentation here. So if there are things that would be helpful to clarify moving forward for that discussion, feel free to bring them up again. Ryan will be here to answer more questions. But as I mentioned, now we're gonna talk about the Cal-ICH State Funding and Programs Working Group. And for context, the action plan calls for the creation of interagency working groups, which are charged with taking the priorities of the council members here, and working together to make progress towards them. So the State Funding and Programs Working Group has been meeting for about a year and is comprised of staff from 13 different state departments and agencies working together to identify ways to ensure the funding and programs related to homelessness across our council member departments and agencies are well coordinated and aligned. So we thought it was a good chance to bring up that group and the work that they're doing in light of this assessment that we just talked about. So it's our pleasure to have Hannah Azamati, co-chair of this working group and deputy director of housing and homelessness at CDSS, to provide you all with some information on the group's priorities and really lead us in a conversation about how can we use the lessons from that assessment that we just heard about to help inform this working group's work. So Hannah, I will pass it to you.
Thank you, Cody. Great to be here with you all today. Excited for this discussion. As Cody noted, I think the goal of this session is really to get direction and input from council members on the working group as it sets out to advance on key priorities, as well as to share how each agency and department has approached and plans to approach the priorities that we have identified. We'll get to that discussion in just a minute, though. I did want to make sure we provide some background on the working group. So some of this was also contained in some of the materials that you might have read ahead of this meeting, but the working group includes representatives from 12 state agencies and departments. And just to highlight on this slide, you can see some of the work streams that fall under this work group. And these include, I'll just mention a couple, identifying opportunities for streamlining deployment of state funding. So for example, the working group has done some deep dives on specific funding opportunities such as Cal-AIM and HAP. Additionally, it is tasked with improving access to funding and programs for organizations deeply engaged with historically marginalized communities, including tribal communities. And to that end, the team has had discussions and cross-sharing of lessons related to tribal outreach and engagement and grant making that has been very helpful. And then the final one I'll highlight is documenting and projecting the cumulative impact of state funding programs and initiatives on the creation or provision of housing opportunities for people exiting homelessness. To that end, the group has discussed how to leverage HDIS and align on data collection efforts across state programs so that we can better track that impact. Next slide, please. This year, the working group has set out to identify a subset of activities from the action plan that are aligned with its mission and for which the working group members see opportunity to make headway within their agencies and departments. We've landed on the following 4 priorities that you can see on the slide. And each department or agency will be selecting at least one of these to make advances on. Some will be doing all 4, some will be doing one, depending on just what the specific circumstances and opportunities are within their department or agency. So the first priority you see here is incorporating a focus on racial equity, data analysis and planned activities within applications for state homelessness and housing focused funding, and analyze the data and information gathered in that response. So this is really about advancing racial equity from the funding and application standpoint. The second is focused on cross-system coordination, so supporting and strengthening expectation of joint COC, county and city planning and coordination and awards and implementation of state homelessness funding. The third is focused on incorporating lived experience, so specifically providing guidance to local grantees regarding the eligible uses of state funds for costs associated with engaging people with lived experience and expertise into planning and decision-making processes, and also encouraging local grantees to hire people with lived experiences into regular staff positions. And then the final item, priority that you see here, really combines multiple activities from the action plan. And it states, implement a wide array of other state and federal funding programs that support a variety of interventions with clear unit production goals, targets, and or a number of households to receive services for the implementation of each program. Next slide, please. So I'd now like to turn to council members and hear their thoughts on the direction of the working group, particularly in consideration of the findings of the landscape assessment that Ryan reviewed, and then thinking through the following two questions that we have teed up to guide this conversation. So the first question here is, given the findings from the assessment, would you like to share any general guidance or considerations for the working group as they set out to advance on the 4 priorities that we have identified? And then secondly, in what ways has your department already built a foundation for these priorities? And what opportunities do you see for your department to continue making headway? And you're welcome for the second question to pick a specific priority to speak to, or a couple if you'd like. So I now would like to welcome folks to jump in and share thoughts. We can focus on the first question first, but if you'd like to address both at once, that is also fine.
Great, and I don't know if you can see the hands, Hannah, but I'm happy to call on folks as I see them. I see Veronica with a hand raised.
Hi, Hannah. Thank you, Ryan. I do have one comment about the previous presentation. Thank you for all the difficult work, and I'm going to respond to him. Thank you for all of the heavy lift that I know it took to get to that data, and I'm excited for the first time to be able to see it that way. To the point that was raised from the education department, I also think it would be useful as we think about our next action plan to figure out what other data from non-direct homeless funding can we capture. So as we think about the interagency piece of our work, which is to really remove redundancies, increase alignment, et cetera, we can have a full picture beyond the directly funded homeless and housing program. So I hope that's in the works. And you know, Hannah, what I'll say to you in the work group, when I looked at the 4 priorities, I appreciate that there's a great amount of work, right? And there's a bandwidth issue as we look at the respective departments and agencies doing all this different work. But given all we know about the harmful policies, given the data that we've seen, I have to say that I feel like racial equity should be it should be an overlay to everything. And there could need to be a phased approach to that, because again, I recognize the bandwidth issues in trying to ask departments to take on all this additional work in addition to, you know, the great work that all of these departments are already doing. But I can't imagine that even when you look at the lived experience and some of the other things you talked about, racial equity is an overlay to everything. And I think that as a member of the newly formed racial equity work group for Cal ICH, I feel like I hope that we can get to that point in the next year or so, because I don't think you can talk about some of these other pieces without talking about racial equity. So I just want to put that out there, that maybe the framing of how we're looking at racial equity changes a little bit as opposed to one of 4 categories, because it touches and it impacts the disparities and the policies and the protocols and all the things that they equate to on the ground for both organizations doing the work, but also obviously the most vulnerable folks that we're trying to serve, is so essential that it needs to be considered across everything. The other thing I would say is, you spoke to this a little bit, and Cody, tell me stop if this comes to the next section, but you know, I keep raising this because I'm hoping that given that we're really now digging into the data and the analysis, like I still have not quite seen the effort to really understand across, even just starting with these 19 state departments, like where are the redundancies, right? In terms of the programs and services being offered, where are the things that are conflict with one another, right? That are the pain points for folks on the ground trying to access these different systems, where are the opportunities to increase alignment? Like, I haven't seen that analysis done yet. And I don't know that we can have really move towards the integration that we're looking for, and obviously reducing the harmful policies and oftentimes conflicting policies unless we have that. So is that a part of the conversations that are happening in your work group at all, Hannah? And again, Cody, if that's a different group's responsibility, then you can tell me that as well. But I haven't seen that yet, or I haven't even heard anybody say we're working towards this. And I don't know that we can fully really look forward to, maybe it's 5 years later, having a transformed way in which our full state of California is serving the most vulnerable populations unless we do that legwork.
Veronica, thank you for that. And as we continue our work in our respective working groups, I'd love to, figure out how we can better intersect and make sure that we're building on each other's work. I'll just note that, I know that the language that I shared around the priorities is borrowed from the activities in the action plan. And while 2 of those 4 priorities specifically speak to racial equity, I think you're exactly right that if we're trying to do the other ones well too, racial equity has to be centered. So when it comes to, the planning and coordination across different systems, that's one of the 4 priorities that I pointed out. Certainly racial equity has to be centered in how we're thinking about serving folks that are most impacted and most vulnerable. And then on the point around the, creating production goals, targets, number of households to receive services, and embedding those kind of goals and metrics into our programs. Similarly, I think we have to look at all of that through the lens of who is actually also then benefiting and being served and being reached through those different elements. So I think you're getting to the sort of next level of how we might approach those. But of course, Cody and others, please jump in as well.
Cody, can I jump in just on one point?
Please,
Veronica, first off, thanks for the comments. I think part of what I hear you saying, and I think it's important to center on racial equity is one thing, but to lead with it or really judge your outcomes based on how we perform on the racial equity aspects of our goals is, I think, really important, and certainly something when I think about the accountability piece that I spoke about earlier and that we've been focusing on, that racial equity, accountability around racial equity can and should be elevated higher than just centering on it. So I think it's a worthwhile conversation for us to continue to have and see where it goes. But your point's, I think, a really valuable one. And if we are going to do more than pay lip service to the challenge and the opportunity in front of us on this, I think it's got to be more than centered, but it has to be the leading focused area. And I think we have some work to do on how we talk about it, and hopefully that piece will lead to how we actually act about it too. So thanks for lifting it up.
Thank you, Dr. Gowdy.
Yeah, thank you. Thanks, Veronica. And just want to acknowledge that, yes, that's definitely like within the purview of this group, right? Like getting together and figuring out where the pain points are across different programs and where there might be contradictions, like I believe you said, definitely within the scope of this work. So thank you for lifting that up. Councilmember Johnson Hall, I see your hand raised.
Yeah, I want to thank Member Lewis for bringing up a point which I thought needed to be elevated, and just underline that. I won't go into more details because she's just spot on and she's right. And I'm really glad to hear that other council members are sympathetic to that, empathetic to that, and understand that as a course of action that we need to take as we're doing this. I will say that when I see the words encourage, I get a little disappointed because I think that we have to do a little bit more about with encouragement, especially during application processes. And I think we need to figure out a way to incentivize folks as part of the application process to ensure that we get optimal results. So I'm not really sure how that's done with the applications that we have, but I tend to think and I tend to see in my practice that it has to be a little bit more than encouragement. It has to be something that's in the application process to get people to move in the direction that we want. So I just wanted to lift that up as something for us to consider as we're looking at the entire application process.
Thank you, very helpful. William, do you want to jump in?
Yes, please. And thank you, everybody. I know this is my first meeting and this is an exciting topic to me and I'm talking a lot. So I believe looking at the priorities, one of the things that I would like to look at or maybe ask you to consider under the lived experiences is how can we tease out the experiences of those people who may be unhoused that have either gone to school in California and what they may have needed from the education system, as well as for those families that may have children going to school right now. That I believe will help the department support our homeless education technical advisory centers in regard to needs and things like that. And then see how we can give technical assistance in regard to heading off some of the issues or needs that the families have. And then I think if I heard correctly too about question 2, one of the things that the department, we don't have funding to do the work. However, we are continuing to partnership and advocate so we can really figure out how we can support families on the other end, especially when it comes to things such as meals and things of that nature that can really be an asset, because we do see when children are hungry, that's when they really have those needs. And if they're unhoused and they don't have those resources, then how can we support our school districts with learning about that or seeing what they can do? But I appreciate the different cross sections. And then again, as we're really delving into racial equity, I really do feel that that should be woven across the priority areas. Thank you.
Thank you, William. That is a very important point as well. Would anyone else like to jump in on either of these questions? Rebecca, I see you have your hand up. Go ahead.
Thank you for that. And I think, I want to definitely echo all my other kind of council member colleagues have raised. And I think also it's really important to think about, I think from the recipient's perspective, right? Getting really clear on the people we're trying to serve, using these fundings and really think about then, what kind of burdens and they have to kind of bear, to shoulder in order to receive these fundings. So I think that goes to the individual level as well as the organizations that could be eligible for the funding, right? So when we think about how we align our programming, in many ways, it's still kind of based on our institutional structures. But then when we think about it from the recipient, from the grantee's perspective, from the individual's perspective, then we have to think about what are the kind of the requirements each of the programming have and whether or not that can be streamlined across the board. And then also, I think it even goes into eligibility considerations and data considerations among different organizations, different agencies and institutions, right? So again, I would encourage this work group to really think about it from the recipient's perspective. And then in addition to streamline funding, but also alleviate some of those burdens, right? Because otherwise we are building an inequitable structure for people with good grant writers will continue to rise to the top to receive funding rather than people who are in need and the organizations that are serving these people.
Thank you, Rebecca. I think that really beautifully bridges actually the first two of the priorities that we have identified, because doing that work really well around making funding accessible also requires that coordination so that not every funder is setting out different requirements. Veronica, please go ahead.
I recognize the nuances, right, with all of the different departments and programs, but can you speak a little bit to the type of metrics that are going to be used to determine the progress? So even though there's very specific things that each of the departments and, you know, units within the departments are gonna have to work towards. There, from our action plan, there are some overarching things that we can develop in a matrix to determine whether or not there's movement. And so can you speak a little bit about what you all are envisioning to really, obviously qualitatively, we'll have to collect information, but quantitatively, so we can really, since accountability seems to be the theme of the day, I want to understand what that looks like, or if that's, you know, coming up in the next few months for the work group to think about. But what are the metrics? How are we going to measure the progress?
Thank you, Veronica. I can speak to that, and then Cody, please jump in too. But I think the metrics are really twofold. It's one set of metrics is going to be backward looking, of like tracking what exactly are we accomplishing with the dollars we're spending. So who is being served, what is being produced, what is the you know, level of what kind of services within each program are folks receiving, and who is receiving those? What is the impact in terms of actually being able to attain housing and retain that housing for folks that are able to then actually be placed in housing? And then there are forward-looking goals as well. So I think this is what the fourth set of priorities really spoke to, is can we set goals? Like, what is our best estimate as to, for example, how many units of housing we're going to produce with a specific funding stream, how many households we plan to serve with a given program in a forward-looking way, so that we can be, you know, both transparent about what our anticipation is of what we'll accomplish, and then work toward those in a coordinated fashion. And then finally be able to compare that retrospective or backward-looking data to see if we accomplished our goals.
I want to offer one thing, because obviously some of the things we're talking about require some organizational culture shifts, right? In terms of practices and protocols, and just this is the way we've done things, and really listening to the folks that have been on the other side of these services and shifting. And so I didn't really hear anything as it relates to those pieces, right? So some transformative, you're gonna hear me say transformative a lot, because ultimately that's what I hope we can do, right? And so there's all this data, there's clear recognition of some of the challenges and gaps we have as a state to deliver the most effective services and maximize the dollars that we have, right, and help the most and do it efficiently. And so a lot of the work that I think I'm hoping we're doing is to transform some of that, meaning that it's uncomfortable and we were having to make some shifts, and there's some power dynamic. There's all kinds of things that go into some of these areas that we said in the action plan we wanted to focus on. And so I would strongly encourage that we come up with some metrics to measure that. And so certainly the outcomes is one part of it, but that's not going to tell the full story. And so I hope that there's some conversation around how are we measuring progress towards these very difficult, in some cases, seemingly abstract things that need to shift within departments and at the state level, because I haven't heard much to that. And that's important in this work as well.
Thank you, Veronica. We'll certainly take that back and into consideration.
Yeah, Hannah, if I can just, you know, build on Councilmember Lewis's point here. I think the outcomes, the way that the priorities are described, the outcomes that have been identified, and also the potential scope of the working group, I think it's great. But I think to Veronica's point, it's really important that if the working groups can help identify very tangible, quantitative metrics that may then help strengthen the overall action plan, because as we go into the action plan conversation, you'll see that the action plan's very rich with a lot of detailed updates in terms of the diversity of programs and services that are being provided, but it's very difficult to, at the highest level, to roll up. So what does this mean, right? And granted, I mean, this is the second year of having an action plan, and so we're building this foundation and building this really culture of cross-sector collaboration and finding a common language. And so I would just encourage the working groups as you come together and continue to define the scope and refine the outcomes. To Veronica's point, you know, if we can pay attention to some metrics, and actually it could be quantitative and qualitative metrics, but to the extent that they cut across the diversity of state agencies that are involved in that priority area and help inform or strengthen the overall action plan. I think it will also help us all in communicating to to communities across the state what the state is doing, where we're investing, where we see tangible progress, where we need to try a different approach or do more, et cetera. So thank you, Veronica, for lifting that point up.
Thanks so much, Secretary. I really appreciate that. And we'll take our last question from Tamika here before we move to the next agenda item, but really appreciate everyone's contributions.
Thank you, Cody. I'll be brief. I just wanted to sort of double click on some of the elements that Veronica was raising, specifically around, the work groups are really sort of the place where the work is happening. And, we come together in these large meetings. So it really seems to me that if we're going to focus on addressing racial disparities, that we understand not only sort of how we disaggregate the data and understand what's happening, but if there's a way to kind of give guidance to local jurisdictions that are actually trying to address the disparities in real time. So when their systems are actually producing disparate outcomes, how can this working group or state partners provide guidance about what adjustments can actually be made in the program administration or the distribution of resources that actually correct for the disparities? Because so often we see them on the back end of the system outcome, and then it's sort of another recognition that the disparities continue, and yet we haven't course corrected for how to reimagine how either the services are being delivered, the resources are being distributed, and then doing that in real time and holding ourselves accountable to see if we then address that disparate impact. And I know there are actually many counties around the state, like Alameda County, who has done a lot of work actually on understanding like what actually happens with Black men over 50 who are receiving rental subsidies and then become unhoused again in 12 months. Like getting that specific, I think would be really instructive for not only the council, but for how jurisdictions who care about racial equity actually want to transform some of those outcomes.
Thank you. I really appreciate that point, because I think you're also touching on the fact that the real work around actually making a difference here is not just about measuring data, but it's using that data in action during implementation. And that's really where a lot of the hard problem solving happens. I know at DSS, we've had a lot of success in investing in technical assistance for our grantees to help them make those very operational, very analysis driven changes that are going to make a difference live. And so we'll have to find more opportunities to both like share what we're learning in terms of how to make those changes, and then be able to share some of that across agencies and implement that in real time. So thank you for that. So I think with that comment, we are reaching the end of this particular session. Thank you all so much for the very helpful guidance and directive for the working group. And we'll look forward to reporting back in some months on how the progress is going as we move toward implementation of all of these goals. So with that, I'll pass it back to Cody to kick off the next agenda item. Thank you.
Great. Thank you so much, Hannah. And thanks to Ryan as well for your presentation. And to all of the council members for the engaged discussion on this. I think you'll see that the next agenda item also gives us a chance to sort of talk about similar themes. So if you didn't get a chance to comment yet, you will still have a chance. So let's move to the next agenda item. Great. So item 6 on the agenda is about our fiscal year 21-22 action plan implementation progress report. I will start this item by providing a brief overview of the report, including some highlights, and then discuss our plans to update the action plan in this coming year. After that, we'll pass it to one of our advisory committee members to discuss feedback that the committee was asked to provide on the action plan implementation. Last, we will ask for council members' thoughts on how to use the information in the progress report and the advisory committee's feedback in order to ensure that the next action plan update is as useful as possible. Next slide, please. could go to the next slide. Just, yeah, perfect. That's great. So just this is all, refresher information. You've probably seen this multiple times. And as you all know, the action plan is really the most comprehensive summary of the work that our interagency council member departments and agencies are doing to prevent and end homelessness. It was originally adopted in March 2021 and is guided by the vision of making homelessness in California a rare, brief, and one-time experience. To achieve this, the plan calls for greater leadership from the state, purposeful action-oriented coordination and alignment, and stronger collaborative partnerships with both state departments and communities at the local level. The plan spans fiscal years 2021, 21-22, and 22-23 this year. The Interagency Council adopted an updated version of the plan in September of this year to reflect more relevant activities for this fiscal year. The plan organizes its activities into 5 broad action areas and includes more than 150 activities across our member departments and agencies. Each of these activities has its own performance measures and timeframes, and CalICH staff report on progress towards these performance goals each year. The first progress report was released in November 2021, and we sent you the fiscal year 21-22 progress report along with the materials for this meeting. And given that the original time frame for the action plan ends this fiscal year, we'll soon go through a process of adding activities for fiscal year 23-24, which I will describe later. Next slide, please. The fiscal year 21-22 action plan implementation progress report has 3 main components: a section of highlights of accomplishments from that fiscal year, a section detailing data on key measures for defining and assessing progress, and a section detailing all of the progress updates for that fiscal year that we got from all of you. And that makes up the bulk of the report. One important thing to note is that this progress report is focused on activities from the original action plan, not the update from September 2022. Given the timing of that update, we didn't think it made sense to have the council adopt an updated report with new activities and then immediately turn around and ask you to report on your progress on those new activities. So given this, not all of our current council member departments and agencies will find themselves in this report, but not to worry, you will be included in future reports, which will use the most recent updated action plan available. So on the next slide, you'll see some more details about the progress report. In order to put this together, we reached out to our partners at each council member department and agency with a list of the activities they had committed to for fiscal year 21-22. We got responses from all 13 of these state departments and agencies, receiving 97 individual responses across 73 distinct activities. As you can see here, the majority of the activities we reported on were in action areas 1 and 5. And on the next slide, I'll go through a few of the highlights for each action area. These are just a sample of the highlights from the report and by no means represent all of the accomplishments listed in that report. So really highly recommend you take a look at that and take it in when you have time. Additionally, since this report summarizes work from the last fiscal year, it's likely not fully up to date with the past 6 months of progress made on any of these individual projects. However, we wanted to pull out a few just to share with you all. And so I'll run through those briefly now. So in action area 1 around strengthening our systems, highlights included CalICH developing and releasing an RFI and RFP for the establishment of a lived experience advisory board, CDE working on the development of the homeless education technical assistance centers to better support students without stable housing. The homeless and housing insecurity pilot from the community colleges served 332 students in the fall 2020 and 672 in the spring of 2021. And then just a number of council member departments and agencies reported taking steps to ensure tribal entities have more equitable access to state funding, with more work on that planned as well. So in action area 2 on the next slide around addressing unsheltered homelessness, highlights included CalICH launching the first round of the encampment resolution funding program, providing more than 48 million to 19 communities. I think we need to go to the next slide. Great, perfect. DHCS's work to get approval for and begin implementation of its CalAIM waivers. CDPH partnering with other state departments and agencies to create and disseminate resources relating to addressing the needs of people experiencing homelessness during public health emergencies. Okay, I'm going to move on to action area 3. I know I'm flying through these, but just want to give us a taste here. So in action area 3 on the next slide around safe and effective sheltering, highlights included CDSS continuing Project Room Key and rehousing strategy in 43 counties and 3 tribes. CalICH implementing the new Family Homelessness Challenge Grant Program, providing $17 million to 10 communities, and Cal OES administering 6 grant programs with approximately 165 sub-recipients that provided nearly 56,000 nights of shelter, among other outcomes. In action area 4 around equitable access to permanent housing, highlights included HCD administering Home Key, which helped create over 4,000 homes across 44 jurisdictions, among other outcomes. CDSS implementing significant expansions in funding across a range of homelessness-focused programs, and the Tax Credit Allocation Committee providing priority for projects serving people experiencing homelessness and LIHTC applications, including helping to create 2,000 units that would be developed specifically as housing for this population. And lastly, in action area 5 around prevention and diversion, highlights included BCSH's COVID rent relief program, which served approximately 350,000 households. Cal HFA's support of 78 active housing counseling agencies that served over 27,000 households, and CDCR is implementing the Returning Home Well initiative. So again, these highlights definitely do not represent all of the work done by our council member departments and agencies last fiscal year. If you're curious about what else happened, we encourage you to dig into that report. And we thank you all and your staff for helping us put together the implementation progress report. Next slide, please. Now, we're really excited to talk about the work that our advisory committee has done to provide feedback on our action plan implementation. So at the committee's meeting on February 7th, we introduced them to the action plan. As you know, they're still a new body. They're getting accustomed to all of our work. So we spent a fair amount of time with the action plan, and we asked for their feedback on its implementation. Specifically, we asked them to respond to 2 questions for each action area. How did they see the objectives or action areas from the plan being implemented in local communities? And what are examples of successful implementation of activities that we can learn from, expand, or refine? We provided that feedback to council members as part of the meeting materials for today. And to provide a summary of that feedback, we have invited one of our advisory committee members to join us today for a short presentation. Roxanne Wilson is the Monterey County Homeless Services Director and a member of our advisory committee. She's going to provide a brief overview of the feedback, and then we'll open it up for discussion on how to use this feedback, along with the progress report, to direct our upcoming action plan update process, which I will describe. We also have other members of the advisory committee present today to help answer questions that the council members may have on the feedback they provided. So Roxanne, I will pass it to you.
Thank you so much, Cody, and good afternoon, members of the council. If we can switch the slide, please. Thank you. Again, my name is Roxanne Wilson, and I'm the Homeless Services Director for the County of Monterey. It is my pleasure to present the Cal ICH Advisory Committee's feedback on the state's performance on meeting the objectives of the plan. And while the committee itself consists of a broad representation of the homelessness response systems of California, common themes were found throughout, like how the pandemic combined with the state's investments provided critical funding that helped us expand services to better meet the demand. Funding was complex, so stakeholders found it most effective to collaborate like never before, especially with people with lived experience. And now that communities are facing funding cliffs, we are scrambling to support the systems we have built over the past few years. Next slide, please. Committee members were asked to provide feedback on our experiences with meeting the goal of strengthening our systems. Some highlighted successes were found in the provision of services through tribal set-asides, the Emergency Rental Assistance Program, and again, the increase of collaboration. Yet the concerns of sustainability were emphasized. Home Key opened the floodgates of permanent supportive housing units, and communities like mine really benefited from that program. However, long-term sustainability is almost impossible to obtain unless through HUD. And there's very little support for administrators. The increasing administrative burden on these grants is too great, especially for smaller communities. And that may cause some of them to walk away from opportunities. The turnover from frontline staff is also concerning, as that can destabilize a program. And one thing that is important for me to highlight is how the point in time count as a sole indicator of identifying a community's needs inadvertently penalizes communities for achieving the goal of reducing homelessness. As mentioned in the slide, a decrease in PIT equals a decrease in funding equals an increase in the PIT. Next slide, please. For action area number 2, addressing unsheltered homelessness, committee members found that Project Roomkey was very successful in getting people who have historically been service resistant indoors and linked to services. Many communities throughout the state created successful multidisciplinary outreach teams, and committee members vocalized a continued need to increase lived experience participation in system building. Also, clean water needs to be available to everyone, regardless of the time of year. Next slide. For action area number 3, which covers the safe and effective sheltering, committee members suggested that the state look into the efficacy of congregate versus non-congregate shelters, along with expanding mental health services to people who are staying in shelters. Committee members highlighted several successful programs, again, like Project Roomkey, Homekey, and the Encampment Resolution Funding Program, however, expressed concerns about the permanent housing destination rates. One member highlighted the effectiveness of the Returning Home Well program. Next slide, please. For action area number 4, equitable access to permanent housing, committee members highlighted Homekey again and the federal emergency housing vouchers as successful housing programs in many areas. However, considerations for the need of long-term operating subsidies, leveraging resources like CalAIM, streamlining resources, and concerns about true accessibility were listed as areas of improvement. Next slide. And finally, for action area number 5, which covers prevention and diversion, advisory committee members emphasized the successes of the state and federal emergency rental assistance programs, especially for youth, BIPOC, and tribal communities. Committee members feel like many instances of homelessness could be avoided or quickly resolved through an increase in homeless prevention and diversion funds, and also better coordination with the criminal justice system. And that concludes my portion of this presentation. Thank you.
Thanks so much for that, Roxanne. Really appreciate you taking the time to be here with us today. So before we move to discussion, I want to provide just a really brief summary of our next steps for the action plan that will tie into the discussion that we're about to have. So as I mentioned, over the next few months, Cal ICH staff will go through the process of updating the action plan to add another fiscal year's worth of activities for fiscal year 23-24. You all have done this with us before, and the process will look really similar to how we did it last year. After this meeting, we will begin outreach to council member departments and agencies to discuss what activities you may want to add to the action plan for that fiscal year. In the second quarter of this calendar year, we will complete those conversations, hold input sessions with a variety of groups, and present on our progress at our next council meeting in May. And we plan to have the update to the action plan finalized, and we'll present it to you all at our September 7th meeting. So it's just like a super quick high-level timeline. We will go into more detail as we sort of get into this process further. But on the next slide, I just wanted to give you that sense of where we're going, because on the next slide, we have a couple discussion questions that we want your all's thoughts on. And we appreciate your attention through this item so far. So the first question that we're curious about is just, what questions do you have about the feedback from the advisory committee? In addition to Roxanne, we have multiple members of the committee present today who offered to be here to answer questions on their feedback as best as they can. I believe I see Margot Cushel, Philip Mangano, Joe Coletti, and Jody Ketcheside have joined us. If I missed anyone, feel free to say hello. And one note is, while they are members of the advisory committee, they may not be able to speak to every question that council members may have. So I'm happy to bring any questions back to the committee if we don't have answers for them today. And the second prompt here is, what we want to know is, how do the progress report and the feedback from the advisory committee affect how you all think Cal ICH should go through the action plan update process? Are there activities or areas for coordination that you'd prioritize in that update, given our progress report that we just talked about and the feedback from the advisory committee? So with that, I will stop talking, and I would love anyone who has thoughts about either of these prompts or questions, feel free to raise your hand in the chat, and we will take it from there. Councilmember Lewis, I think you have your hand raised, is that right?
Go ahead, go ahead. Councilmember Jones, I was just trying to give you, I know what it was like to facilitate in silence, so I was gonna make
No, you're
a
good,
comment
thank
for
you.
you, but go ahead, yeah.
Okay, Councilmember Johnson.
Thank you, and thank you for that work. I just want to really appreciate the engagement and participation of the advisory committee. I just think it's extremely valuable. And so I also really appreciate the specific local examples that were highlighted in the summary report as well. Very helpful as we're continuing our work together. So I think my request, and mostly related to the second question, is that as we are implementing action plan and demonstrating progress made on it, if there are things that the advisory committee wants to flag for us, and specifically additional goals that we might be working on together to further our actual plan. I just am very much interested in that engagement and conversation as we move forward. So thanks so much.
Yeah, and that is a great point. This is not the last we will engage the advisory committee in their thoughts about the action plan. So definitely interested in where they think specifically they'd want to get involved, but also we will be talking to them more about this as well as time goes on. But yeah, thank you for that. Councilmember Damaris, I see your hand raised.
Yes, I appreciate so much this feedback, and I love the way it was laid out for us. Thank you. So easy to follow. There was one sticky note that I didn't see captured on the spreadsheet related to employment opportunities. And I just wanted to connect that our state's 33 area agencies on aging, that's part of the Older Americans Act, is to help with senior employment. And that could be a resource that we could link to as we see growing numbers of adults 50 and older entering homelessness for the first time.
That's great, thank you. Any other thoughts? Oh, I see Councilmember Cooper.
Thank you so much. So I really felt like the feedback was helpful and agree. I think the advisory committee is going to be critical. I think when it comes to CalAIM, we've actually been doing some offlining with a number of people on both the advisory committee or other to figure out how we can create better toolkits. And there's been some great feedback and examples given to us around how we can make cheat sheets and toolkits and show how it's folding through the full continuum. And so just wanted to appreciate those advisory committee members who have reached out directly to me, who've come and presented to our staff, who have connected us to great providers on the ground so we can better inform our policy and guidance as we're moving forward to make it more integrated, to make it not seem so siloed. There's still a number of workshops that we're doing with those entities. And so just wanted to, again, appreciate the feedback and guidance that the committee members have been providing.
Great, thank you. I see Councilmember Lewis's hand.
Thank you. Thanks to the advisory committee members, and thank you all for synthesizing the information in this way. It was very digestible, so thank you for that. CalSCH team. I just want to uplift something I said, I guess, almost an hour ago, just because I think it fits here in terms of as we're thinking about the action plan and some of the things that were called out. Like, I think that the conversation around at least some very high level metrics, so that is somewhat standard, again, with consideration for all the nuances, should be a part of the conversation as well. And I would love to hear what the advisory committee has to say specifically around that part of it. So just wanted to lift it up here because I think it's probably maybe an additional place that it should be considered. Thank you.
Thank you. I see Secretary Castro Ramirez.
Thank you, Cody. I had a very brief and quick question for Roxanne. And it's related to the feedback on action area number 3 under the areas of expansion or refinement. Roxanne, you mentioned taking a look at traditional congregate sheltering and coming up with a way of establishing sort of a ratio of non-congregate shelter to congregate shelter. And I wonder if you could elaborate, or if any of the members that are with us today from the advisory committee can share a little more information on that.
I can definitely speak to my specific community. We do have and support congregate sheltering. However, there is a group of individuals that we're aware of that would thrive better in non-congregate environments. So we are testing that out in partnership, hopefully, with the County of Santa Cruz, where we share an encampment actually that goes along the river that separates our 2 counties, to see if that could help resolve some of the homelessness instances for people who have been historically service resistant. We spent a lot of time getting to know the folks, and it seems like that has been one of the biggest issues for this particular encampment, is that they really do prioritize privacy. And I'll stop here to see if any of the other advisory members has anything to add.
This is Margaret Kushel. Just to say, we certainly see empirically a lot of people who would reject congregate shelter, who would accept private shelter. So, the numbers keep going up. If you offer people housing instead of shelter, the numbers go up further. But shelters with privacy, I sort of reject the idea of service resistant. I think of it as people sort of choosing services that can meet their needs. And there's certainly a larger group of people who will accept non-congregate shelter than congregate shelter, but it's obviously more expensive, et cetera.
Thank you both. Joe, do you have your hand up?
Yes, Cody, I do it. I guess I want to underline this, the last point that Margaret made, is that the reason behind a more balance is because you get advisory committee members have heard over and over and over again from street outreach teams that there are a large number of people that street outreach teams encounter that are never going to go into a congregate shelter situation. They're simply not going to go for all kinds of reasons. So that's really what stems our recommendation. I think that's safe to say for most, if not all of us, in terms of advisory committee members. Thank you.
Thank you. Councilmember Lewis?
Yeah, I'm not an advisory committee member, but I am a homeless service provider, keeping over 2,000 people off the street every night in interim housing. So if I may, Secretary Lord, the other piece of it is, if for whatever reason we still have to have, as a means to an end, congregate shelter, there needs to be a reimagining of what it looks like in terms of all the best practices that our state says that we want to see exhibited throughout different shelters. That's not the case in many of these places, and that's the other reason, beyond just obviously people preferencing privacy like all of us do. Just some of the rules and the way that they're operating are problematic. So I just want to lift that. I don't want to speak for the advisory committee, but I just want to say, since the question was posed, that's a part of it as well. For the congregate shelters that do still have to exist, there needs to be an overhaul of how they operate and what they look like.
Thank you for that. Any other questions from the council members? Oh, Philip, I hear you unmuted. Do you want to speak to this as well?
Yeah, I appreciate that. I just want to heartily agree with Joe's observations. It's broader than just the street outreach, but certainly in the work that we did around the country when I headed up the U.S. Interagency Council on Homelessness and work I've done locally since, there is an opportunity, I think, to evolve our response. And the evolution of that response is, of course, to housing. And Home Key is, primary example of that effort. I think the governor is spot on with that effort. There have been, of course, in recent days, a variety of different names for congregate housing and for transitional housing. All of it needs to be connected inexorably with the solution with permanent housing. So even if there is there are places where congregate housing seems necessary, there needs to be that intricate connection to permanent housing, to Home Key projects, and to other permanent supportive housing projects. But certainly, Joe's observation is spot on. Lots of people who have experienced congregate shelter never want to go back. Thanks, Cody.
Thank you. Any other questions from council members, specifically for members of the advisory committee on some of that feedback provided?
Cody, can I ask just one last question, just based on what Joe and Philip and others have talked about? We're talking about shelter and congregate versus non-congregate in one lens, but I think there's also the conversation about permanent housing, and there's of course individual units, and then the shared housing models. I would be pretty curious to have the advisory committee, not now, but at some point down the road, provide some feedback on shared housing models as the permanent solution and what some of the attributes of successful shared housing models look like. I understand that they sort of fit in the ideal continuum in a certain way, but I am curious, just sort of the same vein around the limitations of congregate shelter. How do we see shared housing models as a either undertapped or even overutilized solution within California's response?
Joe, I see your hand up.
Thanks, Cody. Yeah, in response to Secretary Galley's, just wanted to quickly note that I happen to know that in Los Angeles County, they're doing an unaccompanied women assessment. And some of those questions have focused on shared housing and interviewing nearly 600 unaccompanied women living homeless in LA County. And I'll just say this, that what this report is going to say in regards to shared housing, I think it's will be a little surprising for all of us to hear. So at some future point, this assessment is supposed to be done in about June. So maybe that's something that can come to the council.
Yeah, again, not to deal with now, Joe, but appreciate that, and maybe at an upcoming meeting for a short agenda item, we can add it to the list, because I think this is where the advisory council's experience on the ground is going to be super helpful and insightful, and not looking at it as a one-size-fits-all question either. To your point, Joe, maybe there's certain specific populations where the shared housing questions could be asked in a thoughtful and sort of enlightening way. But thanks for entertaining it.
All right, thank you all. And thank you for that discussion. And you'll see that we have lost our view of the PowerPoint, but we're working on getting that back, working through the technical difficulties that we frequently face here. But as we're doing that, there we go. Thank you, Nicole. Appreciate it. I think we can wrap up here. I don't see any more hands from council members, and we're about at the end of our time for this agenda item. So thank you all for that discussion. Really appreciate it. And thank you to our advisory committee members, for your attendance today and your work outside of these meetings. Just want to say, clearly your input is highly valued amongst our council members. So we really look forward to engaging with you all more on the council agenda items in the future. So I'm going to move us to our last agenda item. So perfect. Thank you. As many of you know, the U.S. Interagency Council on Homelessness recently released the Federal Strategic Plan to Prevent and End Homelessness. In this agenda item, we will hear a brief overview of this plan from our USICH partners, Helene Schneider, Senior Regional Advisor, and Katie Jennings, Policy Director. We will then have a discussion about opportunities council members see to align with the USICH All-In Plan, or the support needed from other federal partners in order to further our work to prevent and end homelessness. And I misspoke a little bit earlier. This is not our last agenda item, but our last discussion item here on this agenda. And we appreciate your all's attention and engagement as we go through this. So Helene and Katie, I will pass it to you. Thanks so much for joining us today.
Great. Thank you, Cody. Thank you, everyone. What an amazing combination of discussion items today. And I think it leads really nicely into this presentation about All In, our federal strategic plan to prevent and end homelessness. I want to recognize and introduce Katie Jennings, my policy director, partner in today's presentation. Katie's been key instrumental in making this plan come out in all the iterations, both in the planning of it and then after it's been released. So she and I are going to share the presentation, so you just don't hear one of us blabbering away, but we also want to give enough time for a dialogue with all of you and really just focus this presentation not just on what the plan is, but how we can incorporate it and align federal and state policies and resources and connections together moving forward in an implementation process. So we know this is the beginning of a conversation, not the end of one. As you know, I come onto these meetings quite a bit. I connect with many of you regularly, and I hope to continue to do so. If we can go to the next slide, I am really briefly going to just talk about how we got here. But first off, in this plan, really a big audacious goal for us as a federal agency to put right out there that our vision for the future is to reduce homelessness nationwide by 25% by 2025. And we are to build on a vision of a nation which no one experiences the tragedy and indignity of homelessness, and everyone has a safe and stable, accessible, and affordable home. And we know we cannot in any way, shape, or form meet this goal on a national level without California. So we are all in making sure we can try to make this connection as strong as possible. If we go on to the next slide, how we got here, and again, real brief because I want to get to the meat of the stuff, but we had over 80 listening sessions. We had 1,500 public comments in our portal. We had connections with over 500 people who said that they had lived experience, really brought that information back into our process, learning from key informants about racial equity, lived experience, tribal and LGBTQ plus, QI plus individuals. 2,000 comments plus from the federal agencies, and Katie was in her policy team were instrumental in bringing in all the 19 different federal agencies and all their comments into this plan. What we heard in the next slide, our biggest challenges are all the same things you've been saying here in California in your action plan, talking about lack of housing supply, the rising rent and slow income growth, inadequate access to supports, the unsheltered homelessness rising, particularly on the West Coast, concerns about criminalization related to homelessness and policies related to them, and really wanted to acknowledge, especially during COVID and beyond, the fatigue and trauma among providers. This is hard work each and every day. On top of that, with a global pandemic, people are dying on the streets, people are dying in shelters. What can we do to make sure that we can eliminate that as much as we can, but really also honoring and respecting and acknowledging the hard work of the providers in play as well. What we heard also of our greatest opportunities in the next slide was, we learned a lot during COVID, and we had unprecedented investments between the American Rescue Plan, the CARES Act, the budget requests that came out and we will continue to do in different budget requests moving forward. That's a congressional issue. We'll be talking about what we can do at the executive branch, but that demonstrated commitment, looking at executive orders related to equity, looking at executive orders related to housing production and streamlining processes. Lessons learned that we learned about how non-congregate shelter worked. The project Room Key that you're able to to categorize and show data on a statewide basis, bringing in FEMA in a way that we've never done before. How do we continue that moving forward? How do we get your reimbursements back faster? We are working on that, I promise. But you know, things that we have learned through this process as well, and the opportunities that we can hopefully have moving forward. That focus on racial equity, President Biden signed executive orders his first week in office. Every single agency within the federal government has to put together an equity plan, looking at their policies, looking at equitable outcomes. And this unwavering dedication that we've heard from throughout, not just our federal agencies, but throughout the country, service providers, local leaders, business groups, you name it, everyone we spoke to about this unwavering dedication moving forward. So this then came up to what we came up with, these pillars with all in, and I'm going to turn it over to Katie at this time to get us started here. Katie?
Great. Thank you so much, Helene, and thank you for having us. I was saying to Helene that if I close my eyes, I would think that I was at one of our council meetings because we grapple and deal with so many of the same challenges and issues. So it's really nice to be in community with all of you today. So All In, the federal strategic plan to prevent and end homelessness, it was released in December of last year, and it's really built around 6 pillars. So we have 3 foundational pillars, which are equity, data and evidence, and collaboration. And then we have 3 solutions-based pillars that are centered around scaling up housing and supports, crisis response systems, and homelessness prevention. Next slide, please. So within these 6 pillars, we have 6 pillars, we have 30 strategies, and then we have 178, almost 180 actions across the federal government. For the purpose of today's discussion and just to save on time, we're going to provide examples of strategies under each pillar, but we won't go into detail on all of the strategies and actions in the plan. That could take forever, and we don't want to talk that long. So really encourage you to read the full plan to get the full kind of scope of what's in there and what we're planning to do with our 19 member agencies. Next slide. So I'm going to talk about the 3 foundations pillars, and then Helene will take it and she'll talk about the solutions-based pillars. So the foundation pillars are really focused on how we do the work of ending homelessness to really try to ensure accountability, authenticity, inclusion. And so the first of the foundational pillars is lead with equity. Throughout the plan, you'll see quotes that we compiled from our various listening sessions and our online feedback. And we wanted to highlight this quote that comes from a person who said that they had lived experience from Washington, D.C. And it says, "Inequitable access is rooted from the top down. The federal government must be tasked with recognizing and allowing for the undoing of systemic and institutional discrimination that permeates its systems." Next slide, please. So an example of one of the strategies under this pillar is really examining and modifying federal policies and practices that may have created and perpetuated racial and other disparities among people at risk of or experiencing homelessness. I think as folks were kind of talking about before, we've gotten better and better at naming the problem and looking at the data, but we have not necessarily named the path to kind of a better future that we want to see for everyone. So examples of policies that we could end up looking at. One example is we always tell communities, and we tell ourselves too, you have to compensate people with lived expertise for their time participating on advisory boards and committees. Well, one of the barriers we're hearing from communities is that sometimes when they compensate folks, it jeopardizes people's eligibility for other benefits or income supports they might be receiving, and a benefit cliff, if you want to call it that. And so how do we look at policies like that to help ourselves and communities compensate people for their emotional labor and their time? Another example is fair housing. We've got HUD has recently put out a affirmatively furthering fair housing proposed rule that's out for comment right now. How do we prioritize people for housing and support? So really looking across all of our programs, talking to people with lived expertise about how they experience our programs, and seeing what we can do to modify some of those policies. Next slide. Our next foundational pillar is about using data and evidence to make decisions. And the quote from this slide is from an advocate from Texas, which says, "Bring people of color to the tables where discussions are happening. Don't just rely on nuanced data that we know is inaccurate." And I think this quote really speaks to the importance of qualitative data in addition to quantitative data, really asking people who are experiencing homelessness or at risk of homelessness what they need, listening to them, and then carrying out their recommendations to the best of our ability. We were just talking about non-congregate shelter a minute ago. I think that's kind of a perfect example. How do we make sure that we're actually bringing in that qualitative data and listening to people when they tell us what they need? So quantitative data also really important, but just doesn't give us the full picture. So next slide. Examples of just strategies under this pillar is really strengthening both our own capacity to use data and evidence to inform federal policy and funding, and then strengthening the capacity of state and local governments, tribes, and others to also collect, report, and use data. So examples of actions, how this might play out might be issuing guidance on how communities can create data sharing agreements and really addressing either the real or perceived legal barriers. I know a lot of communities and states have already done really great work with data sharing across systems. So how do we provide other states and communities the tools that they need to really feel like they can share data? Strengthening our own data sharing across the federal government. There's already some data sharing agreements that exist between agencies, but what other opportunities do we have to use data matching to streamline processes for people? Engaging stakeholders, including people with lived expertise, to really understand how they, like I said, how they're experiencing our systems and use that information to really improve the customer experience. And then developing, and there was a lot of talk of this earlier as well, and we'll talk later about kind of our initial idea about how we're going to measure our progress. But really, we need to develop additional milestones and outcomes and metrics that are telling us how we're doing and how we will assess progress. And so that's something that we need to do as well. Next slide. And our last foundational pillar is collaborating at all levels. This may seem like a no-brainer, but we felt that it was really important to be in the plan. If it's not named, it doesn't always happen. So the quote here is from a housing developer from Portland, Oregon, and it says, "Homelessness and affordable housing supply won't change without a long-term commitment and implementation through a partnership of public and private sector stakeholders." Next slide. And so an example of a strategy here is promoting collaborative leadership at all levels of government and across sectors. And examples of what we might do here include leading and launching a coordinated messaging campaign to combat some of the harmful narratives that we see that are kind of putting our housing first orientation perhaps at risk in these attacks that we're seeing. Another example would be launching joint collaborative technical assistance. So there was recently the HUD and HHS Housing and Services Resource Center was launched not that long ago, which is a joint TA center to help communities kind of braid housing and services dollars together. So with that, I will turn to Helene to talk about our solutions pillars, and then we'll be quiet.
Great. So the first one for our solution pillars of scaling housing and support to meet demand, and to quote this provider from New Jersey, "Services are not effective without housing, but housing's not sustainable without services." We heard a lot of that just now at this council meeting. I've heard it at various Cal ICH council meetings. If you go on to the next slide, and I want to acknowledge the state of California and their commitment to a housing first philosophy, and the understanding that for housing first to work, is housing first does not mean housing only, that we really need to ratchet up the level of housing production and supply along with the services. And that we know works. There's data that shows that, right? We know this. We know through looking at veteran data, for example, since 2010, veteran homelessness has gone down to 55% since 2010. And we know why, because we've been able to have those resources, the resources of both the housing and the services. So how can we do that with other populations? So some of the strategies, including here, maximizing the use of existing federal housing assistance, creating new safe, affordable, and accessible housing, strengthening that system capacity to address the needs of people with chronic health conditions. The conversation earlier today I heard with Corinne talking about CalAIM and, you know, having a prescription for rent that's an ongoing discussion and ongoing funding source is huge and a game changer. And so this is part of what we mean as some of the strategies and actions that could happen in scaling housing and support to meet demand. Going on to the next solution, onto the next slide, is improving the homelessness response systems, right? So again, from Texas here, homelessness, regardless of a pandemic or other natural disaster, is a crisis, and the response should be a crisis response until the immediate urgency is addressed. We learned so much of that during the COVID pandemic that I think many of us in the field knew that homelessness is a healthcare emergency, but it wasn't as well known maybe with everyone within the public health arena or within the general public until we saw this, especially when it came to the need to have non-congregate shelter in order to mitigate the spread of the virus. So on to the next slide here is looking at particularly unsheltered homelessness and improving the homeless response system. All of government efforts. So not just HUD and HHS, as important as those are, but looking at, you know, Department of Education, looking at DOJ, looking at Social Security, figuring out how do we reduce barriers with documentation to get people from the streets and into housing. Do we need all those requirements? If it's statutory, how do we make it as simple and streamlined as possible? If it's not statutory, what can we do to reduce the layers and repetitive types of bureaucracy that's required? How do we solidify the relationship between the continuums of care, public health agencies, and emergency management agencies? I think in California, especially because the state has provided so much financial resources, people are understanding what a COC is, and that was not always the case maybe 5 years ago. Cities in particular, I can tell you from coming from one, right, from before USICH, that they're understanding there's this thing called a COC and they have funding, and how do we get access to that and how do we connect? So solidifying those relationships as well. And as I already mentioned, removing and reducing programmatic, regulatory, and other barriers that systemically delay and deny access to housing for households with the highest needs. We had a great example of that. We'll talk a little, I'll bring it up again in a little bit, but during the funding that we had for rental assistance in the Treasury Department, putting out funds during the CARES Act and ARPA funds, and finding like federal agencies were asking, how come we're not seeing that money being allocated as quickly as we know that there's concerns about evictions and people needing rental assistance, and then learning, well, there was all this paperwork that needed to happen ahead of time in order to get the funding. So then a switch about how to have self-attestation of what was needed to get the funding and then figure out the bureaucracy ahead of time. So that reducing that programmatic stuff, what can we do moving forward in keeping that connection there and improving the response systems as much as possible. And then our final, if you go to the next slide, on prevention of homelessness. And by prevention, we're not talking about someone right at the moment of imminent crisis. What we're doing here, and this is new for us at USICH, is going way upstream of looking at what are our federal policies, how does it connect with state and local actions, of ways that we know when they work, they do prevent homelessness, but when they don't, people can fall into homelessness. Because we know, and this is, I know from Secretary Castro Ramirez's introductory remarks and accountability, if we really want to see a reduction in homelessness on a statewide level or a national level, we've got to turn off the source at the tap and figure it out upstream, what is happening. You're experiencing, we know that the amount of work happening, moving from people from shelter and unsheltered homelessness into housing, amazing work's being done. I mean, nationwide, as you can see from this slide, 908,000 people entered homelessness each year, right? But only 900,000 were still housing. So it's an amazing amount of work, but the inflow is really jeopardizing the overall success that we have. It leads to frustration amongst not only statewide leaders and local leaders, but the general public. They're not seeing results. We're not seeing the numbers. So what can we do to prevent homelessness here? And just to have the quote here, so much of the work around houselessness is focused on the emergency of it. That is kind of the nature of the work, which I understand. But until we can go way upstream, it will always be an emergency and people will always be struggling. This came from a student in Missoula, Montana. So if you go to the next slide, what do we mean by this? And again, this is new for USICH and trying to figure out what our role is. We're not, as a small agency of 20 people, when we're fully staffed, able to solve poverty in the United States. But what can we do with our 19 different federal agencies to frame systems so that we can prevent homelessness from happening? How do we do that with publicly funded institutional systems who are exiting from them, like jails or hospitals? How do we do that with older adults and people with disabilities? We know that the workforce is not an opportunity for many of them. And so what are other things we can do to prevent homelessness from occurring? Veterans and service members returning from the military into civilian life. We know that that process is going to happen. How do we ensure their success there? Looking at American Indian and Alaska Native communities living on and off tribal lands. Youth and young adults in particular, and particularly those who identify as LGBTQI+, but also we know that youth experiencing homelessness are primarily people of color. This is a racial equity issue, and it creates, without interaction, a multi-generational concern that we have about homelessness moving forward. If we look at foster care systems, for example, we know when someone in the foster care system is about to exit the system, what can we do to prepare for that person's success? The data is showing that we're not very good at that, and we could be so much better with that. Unaccompanied women came up quite a bit. I know there's a state bill looking at that for data analysis. We're looking at what we can do on our end. And one of the ways is looking at survivors of human trafficking, sexual assault, and stalking. What are the policies around there to make sure that women and survivors get access to housing, even if they're currently in public housing and need to leave that public housing because of a domestic violence or sexual assault situation? How can we prevent their homelessness as well? So if we go on to the next slide, I'm going to bring it back to Katie about how we'll measure progress, and then we'll turn it over for framing a dialogue that we hope to have with all of you.
Great, thanks, Helene. So how will we measure progress? And I want to just emphasize that this is a starting point. We know that there are a lot of other sources of qualitative and quantitative data that we can be looking at. But as a starting point, we will be focusing on some of HUD's system performance measures, Department of Education data on the number of children and youth experiencing homelessness during the school year, and other available data on racial disparities as ways to measure progress. However, we know that much of this data is only reported annually, and some of it is kind of on a bit of a lag. And so we need to find additional metrics that we can look at on a more regular basis where we can measure our progress nationally and also provide tools for communities to measure their progress locally. So we definitely have a lot more work to be done on that. And we will be, we've started planning implementation of All-In, and it's going to look very similar, I think, to the implementation of your action plan at the state level, where we'll have work groups and action teams and task forces working on specific things. But this is kind of how we'll start in terms of measuring progress. Next slide.
Great. So we, in hoping to kind of frame the conversation we want to have with each of you, there's some opportunities we know that can happen between USICH and CalICH. And how do we share information? What kind of things have we been able to do at the federal level that maybe can be replicated in a state equivalent and vice versa? And so just bringing up some examples that we thought up and looking at not just HUD and HHS as well, but also every single agency that we have, right? So I mentioned Treasury and the self-attestation waiver for the emergency rental assistance. I already mentioned that about issuing waivers. Lots of waivers happened during the pandemic. What things can we continue or that doesn't need a statutory requirement, but ways to figure those streamlining pieces out. New funding opportunities, taking our 315 million of the NOFO for unsheltered homelessness doesn't come even close to the 750 million just for the state of California to address unsheltered homelessness and encampments. But yet the way I think HUD did that was very innovative. And what they did was able to take underutilized COC funds from programs that weren't meeting their goals, and then being able to repackage it and focus it on something of immediate concern, like unsheltered homelessness. So creating those new funding opportunities. in the infrastructure funding, Department of Transportation, incentivizing zoning reform, right? So there's that part in an infrastructure bill that doesn't specifically spell out homelessness, but there's ways around that we can look at how to incentivize the production of housing that could provide additional affordable housing. Initiating other interdepartmental working groups. So not just, focusing on an issue like survivors of domestic violence or housing technical assistance. So looking at both, how do you bring in HUD, HHS, DOJ, probably Department of Labor, other things that could happen with different interagency groups. And then streamlining regulations. We're looking at surplus property reform. I know the state's doing so as well. That also brings in various different interagencies together. So I guess should we go on to the last slide here and then open it up to all of you. Here's the link here to how to get to our plan. And I'd love to talk about how each of the different council agencies, what is it that they can promote, which I think we heard a lot of in the last couple of hours already. But if there's anything in particular, we should talk about how federal and state issues can align better. And please, again, this is the beginning of a conversation. I am your senior regional advisor for the state of California. That's all I do for USICH is the state of California. And I hope that we can connect on a more regular basis. And so with that, Cody, back to you if you want to open it up for the dialogue moving forward.
Great. Perfect. Thank you, Helene and Katie. Now we'll open it up for discussion from council members. I just want to acknowledge quickly, that all three of the discussion items we've had on today's meeting are highly interconnected. We heard about an assessment on our state programs and funding. We heard about the working group with the goals to coordinate those programs and funding. Our action plan progress report and feedback from our advisory committee on implementation of that, and now the federal plan. So in thinking about these questions, I just encourage all of you to think about, what is it going to take for us to reach our goals to prevent and end homelessness in California? And how can we move forward effectively as a council, but also with our federal partners here today to do that? So I'm going to open it up to you all now to discuss the following questions, or sort of any that we've talked about that feel relevant to this discussion. So where do you see opportunities to align the USICH all-in plan and coordinate our federal advocacy to further our collective work to prevent and end homelessness? And what support do you need from our federal partners in order to effectively implement your commitments in our action plan? So those are sort of anything that has come up in hearing the presentation from USICH. We'll throw it to council members now. We'll give people a minute to sort of digest and think about it. Secretary Castro Ramirez.
Yes, thank you, Cody. First of all, Helene and Katie, thank you so much for the very detailed presentation, both in terms of the overall vision, the process that led to the all-in framework, and both the focus, the pillars, the focus on the problem that we're trying to solve, but also the focus on the solutions that cut across many, federal entities. And I really appreciated also the way that in listening to the presentation, Helene and Katie, you all were also drawing upon how the federal approach aligns to what the state is doing, the way that this council has come together to be more thoughtful, more strategic, better coordinated, and also very intentional, right, in terms of addressing root causes, addressing homelessness with a sense of urgency, and laying strong solutions that are long-term solutions, right? Not just sort of the addressing the urgency of the moment, but also laying a new way of addressing whether it's through the focus on creating more housing that's deeply affordable, changing the way that our housing finance system prioritizes affordable housing, whether it's at the state level, calling for more accountability from cities and counties in terms of producing their fair share of housing. So there's a lot of alignment. I guess all that to say is that there's a lot of alignment in terms of what the federal government is doing. and what the state of California has been doing for the last few years. And so I really appreciated drawing sort of the comparison. The second point that I wanted to share and make is that as we move into operating in an environment where many of the flexibilities or the waivers that were granted under the state of emergency, I think this is where we have a tremendous opportunity, right, to be able to prioritize those waivers and those flexibilities that were most effective in streamlining the process, in connecting people to services or to housing. I know definitely in the housing space, we have a list of ideas, but this really cuts across, every council member, every member of this council. And as you begin to sort of think about the emergency ending, what priorities, what flexibilities, what waivers that were granted were most effective in terms of being able to deliver the programs that we delivered. So that's one way maybe of thinking about the opportunity that we have with the all-in plan, right? To be able to align to our federal sort of counterparts and providing the list of flexibilities, or essentially maximizing the federal resources and maximizing federal flexibilities to enable us to continue to move at the speed that we have been moving, and to not, even in an environment where we have fewer resources, to not be able to, to not have that sort of affect the focus, the momentum, and the sense of urgency, right, that we have brought to this issue. And then the last thing that I will just say is that I really appreciate the president's leadership on this. President Biden, Vice President Harris. I mean, I think it's clear, right, that there's a recognition that it requires, this all-of-government approach at the federal level. It's an all-of-government approach at the state level, and it requires an all-of-government approach with our local partners. And so that spirit of doubling down is so appreciated. And I just wanted to essentially pass along our appreciation to the Biden-Harris administration, to the folks at USICH, and to the 19 federal entities that have crafted this plan that I think will help strengthen the work that we're doing here in the state of California.
Thank you. I will mention on the waivers, one of the things that we've looked at in this plan and will continue to in its implementation is figuring out what the barrier is and what the source of that barrier is. Like, is it a statutory requirement from the federal government? And I think a lot of times we think it must be, and we find out, in fact, it is not. That maybe it's an interpretation of a rule, or maybe it's not even the federal government saying you have to do it this way, but it's a local housing authority or a state issue or a local issue. And just figuring out where that piece happened, and it may have happened originally, whatever that regulation is, for a very good reason when it was implemented, but over time made it seem like this was the only way to be able to do things. And so digging deeper there, I think is going to shed a lot of light of what can be done outside of congressional acts of Congress, right? So just to bring up your point, thank you, Secretary.
Great, thank you all. Councilmember McGee.
Yes, thank you. Thank you for the presentation, and I appreciate Councilmember Castro Ramirez's comments as well in regard to flexibility. I believe when I was looking at this, and then my team had been messaging me, about this, this takes me back to when I was a principal at a middle school, and I had two students, their sisters, who were unhoused, and their family really did the best they could to get them to school. And so one of the things that I think about is, how do we leverage education more in these discussions? this is something that my team has mentioned, that we're asked to do certain things. And then once we complete those tasks by either looking at applications or looking at data, then we're not engaged after that. Excuse me. And so then how do we in education continue to be partners and sit at the table so we can be along with the entire conversation? So I think that's one thing where the first question says, where do we see opportunities to align that work? So the continued collaboration is very important. And then I think about our superintendent's initiatives in regard to transforming schools. And a lot of that is dealing with universal preschool or universal pre-kindergarten, meals and things of that nature, after school programming. So how do we leverage those type of ideas, those type of functions, and then working with our families who may be unhoused? So then that way, if it's going to, let's say, training in the regional occupation program, which allows for people to get certificates, and then they can get that without having a debt of college. How do we leverage adult education, regional occupation programming with after school programming? So then if they have families, then there's care in the after school program, and then there's high quality meals. So that's what I would say in regard to opportunities for aligning. And then I guess the last thing about the support, again, as I mentioned, Council Member Castro Ramirez's comments, flexibilities, and then also engagement, because we know that there's uniqueness in California, but then there's also uniqueness within individual communities in California.
Oh, that was awesome. I love the way you're thinking about all this, because I totally agree with you that the education system has such a role to play. I think we've seen some really good examples especially through HUD's Youth Homelessness Demonstration Program, of partnerships between continuums of care, the homeless services system and schools, being able to kind of make referrals and connect people, students experiencing homelessness to housing and supports. And I love that you brought up the adult education as well, because I think that's one office within the Department of Education we haven't done as great of a job of engaging, that I've always wanted to. So I think I'm really glad that you brought that up as well. And I think the education for homeless children and youth program through Department of Education is amazing. And I also think if school districts receive a grant to have their the homeless coordinator position funded, that's great. But then in other schools, it's not a funded thing, and you've got the school counselor wearing the hat of also the homeless coordinator. And so how do we get more support to people within schools that are working with homeless students and families? Helene, anything you would add?
Yeah, a couple. I mean, I'll go back to talking about prevention in the foster care system in particular. I mean, here's a group of individuals that we know are in a particular system that has an end date. And we know the data is showing that a majority of them experience homelessness within a few years after exiting that system. And so the question is why? We should be able to prepare better for that. My other thought with the state of California in particular is, unlike the federal government, you have much more hands-on direction and authority with the UC and CSU and community colleges system when dealing with students who have housing insecure situations, and how to implement that or incentivize and focus on those students to be able to pursue a degree and still not have to worry about paying the rent and having a place to study and succeed in that capacity. I think California in particular is in a unique situation, well, states in particular, if you have a state educational system, but in particular California with those three layers of the higher education component there too.
Councilmember Ron O'Shaughnessy, I see your hand. I think you might have something to add to this conversation as well.
Yeah, and so yes, and when you talk about community colleges and the public higher education segments, I feel like I have to jump in. And Councilmember McGee, I'm talking to my staff, and I think we definitely need to connect to think about that continuum, right, for our students as they exit kind of the K-12 system and into the higher education segment, what that looks like for them. But I think an important element also to emphasize is the governor's office also has invested historical investments in affordable student housing for the higher education segment. So, and then we have to say, from our system's perspective, this is kind of stepping outside of our traditional education boundaries. So, and how do we think about leveraging public resources and other resources there and the momentum they're currently ongoing in supporting housing prevention and homelessness? How do we align these forces, and also thinking about the resources to really support community colleges and UCs and CSUs to enhance their capability to build up affordable student housing to really support our students, and then also how to adapt this kind of housing first philosophy in higher education when there is an end date. So what that will look like, I think it's a kind of an emerging area that we definitely would like a lot of thought partnership around. So just want to offer that and just kind of express our excitement in playing a bigger role in this work.
Thank you all. And just to make the connection, right, like these are all things as we're identifying these connections that we can include in our update to the action plan, right? So this is great time to start thinking about like, where are there collaborations, where are there connections, what are we seeing that we can sort of commit to in that plan as well. Right, Councilmember Lewis.
Yeah, thank you so much for the presentation. Really exciting to see what you all are doing. I think there's some pieces that our council can pick up from how you all have organized and framed your work. I'm shifting gears from the education conversation. Just wanted, and I hope I can circle back with some more detailed thoughts in relation to like policies and regulations. But I just want to lift up two populations where there's a lot. One of the populations, there's a lot of conversation around understanding the deep connection to homelessness, but folks that are returning home from jail or prison, there's a whole lot of conversation, but there's not a lot of resources, right? And in some cases, there's been a lot of progression made in the last 7 years, even especially at HUD, but there's still some exclusionary criteria from some of the resources coming out, and just more broadly, the factors that it really takes to help stabilize folks returning home. It's just, I think there's some things we could do. And again, I would appreciate the opportunity to maybe email you later with some more specific. I just want to lift up that population. And then, I'm from Los Angeles County, and we one of the largest homeless and housing organizations in LA County, in our particular region, which is South LA, Compton, Linwood, and surrounding areas, has the highest incidence of families that are experiencing homelessness. And something we see time and time again are families with adults that are cared for by parents that have developmental or other disabilities. And it becomes very, and I don't hear it really in any of these spaces, it becomes very difficult to provide support to families. In some cases, there's multiple adult children that have significant disabilities, and I just don't hear it talked about enough. And I think, again, I want to circle back with some specifics, but I want to lift up that population because we are increasingly seeing more families with adults that need 24-hour care, and it just becomes more complicated in terms of how some of the policies are structured related to traditional families with children or minors in need care. But there's a lot of families with developmental with adults that are in the care of the parents as well. So
no, thank you for bringing up both those examples. One thought that comes to mind on the population exiting correctional institutions or whatnot, if you look at our 6 pillars, like it's an equity issue, right? And it's certainly, we need better data and understanding where people are coming from and what they're able to do and what outcomes are there. It's a collaboration concern. It's certainly an issue about how to connect housing and supportive services to them. How do we prevent the incarceration to begin with in other opportunities, and then how do we deal with the immediate crisis for sure. So, and then on families components too, some of the other things we're talking about in the implementation and breaking down barriers is there's some rules that are out there related to who might have a voucher, for example, but how do you share that with a family member and what the rules are around that? And, there's sometimes barriers that we find if someone wants to go back and connect with their grandparents but maybe the way the structure of their voucher doesn't allow for certain things for the same kind of benefits, like all this wonky kind of stuff that we have to kind of unravel. Yeah. So, but appreciate those two examples, Veronica. Thank you.
Yeah, and one more thing that you said, you spiked another the mixed families in terms of legal status as it relates to long-term subsidies.
Right.
Very challenging. So just something else to flag. You said something that reminded me of that. So thank you so much for listening.
Oh, thank you. Please
Hey,
do
Cody,
email us.
Can I jump in with two thoughts? First, Helene and Katie, thanks for the presentation. Great to see the all-in framework and really resonates. Just two things. When we talk about waivers, and I think as a proud Californian, we've used them often and aggressively. Thank you for the support on that. I think one area where maybe we have more opportunity is, I would just say, like cross-cutting waivers that are not just focused on a single agency at the federal level or the state level. And there's good examples. I mean, I think about the VASH voucher system, which is really this bringing together of a HUD and a VA focus to break through probably collective barriers and really cross the silo in an effective way through a waiver. We've tried to do that on the health side with a number of things, and CMS is super innovative, and along with our leaders at DHCS, but there's probably some opportunities to think about waivers in an even more, innovative way that crosses some of these barriers or natural silos. And I think we'd appreciate a chance to think through that and push on it, not just at the agency level, but the USICH level. I think the issue that Veronica just brought up in terms of those exiting incarceration, the housing, the homelessness issues, the opportunity given what CMS just approved in our Justice Initiative package as part of CalAIM creates a really interesting place to sort of go a little farther and deeper on how we connect the dots between some of the HUD resources and those resources within CMS and Medicaid. And then the second thing, just because we have been trying to undo this sin over time on the health side, where the feds and the locals and the states all have different reporting focus and metrics around health data, especially around chronic disease or just about anything. And we've tried to talk about aligning data sets for a long, long time. As I know we are thinking about what does accountability look like? What do data and data dashboards look like? Making sure that there's some alignment and we don't put providers through the ringer with two different sets of metrics. I'm sure it's something you talk about, but given the focus that you all raised today and our discussion on accountability, just reminds me to lift up the fact that we should probably try to make sure before we go live and in public with what any entity does, that there is as much alignment as possible. So thanks again for the presentation.
Thank you, Secretary. That's highly wonky stuff that's so important, right? I'll also mention, I'm going to quote one of your advisory council members and former USICH Executive Director, Philip Mangano, that one of my favorite phrases is legitimate larceny, that he has said before, meaning taking best practices from other areas and repeating them elsewhere. And one of the things that we can also provide at USICH is not just looking at the alignment between federal and state of California alignments, but we talk, my team, the National Initiatives team and policy talk to the whole country, of course, right? And there are statewide ICHs all around that some are brand new, some have been around longer. They're all kind of variations on a theme, but different, and having, you know, working with your staff and seeing and connecting best practices there of what's happening perhaps in like Minnesota or Michigan or North Carolina and what can work in California and vice versa. That's another one of those type of activities that we can do together to move things forward and find some legitimate things to, you know, some legitimate larceny to correct over here in California.
Great. All right. Well, I don't see any other hands, and we're running about at time for this agenda item. So I think we will wrap up here. Thank you all. You really appreciate the discussion on this item. And as Helene mentioned, this is just the beginning of this conversation. So we'll definitely make sure to loop back on how we can continue this discussion and move this work forward together. All right. I know that was a lot to cover in today's discussion. So thank you all. Thanks to all of our presenters for their time, our advisory committee members, and to, you know, our council members here for staying engaged in these three conversations. After this meeting, CalICH staff are really going to spend some time with what you all have brought up and find ways to use it to move our work forward effectively. So just thank you all for being engaged in all of this. Since we are out of time for this agenda item, we're going to move to the next item. Also, if anyone did not have the chance to share, please feel free to send us your comments and we can share them with the group. So I will now turn to Giselle Sanchez to facilitate public comment.
All right. We will now accept general public comments. As a reminder, to ensure everybody is given a chance to speak who would like to, we will allow for a maximum of 2 minutes for each comment. Our team will put up a 2-minute timer on the screen and warn you when you have run out of time. We welcome all public comments and feedback. However, due to the structure of this meeting, we are unable to respond to them. For this reason, if you have any specific questions that you'd like answered, please email us at calich@bcsh.ca.gov. If you're connected through Zoom, please select the raised hand icon in the meeting window of your computer. For those joining us by telephone, you may press *9 to indicate you'd like to comment. Once I call on you to speak, you'll be instructed to mute yourself and you'll have 2 minutes to make your comment. All right, we're going to switch our screen to a timer. I'll give everybody a minute to put your hands to raise hands. All right, thank you, Daniela. We currently have 3 hands raised. Apologies for any names I mispronounced. First up, we have Jerry Lundberg. All right, you have 2 minutes to voice your comment.
Thank you very much. I'm Jerry Lalondeberg. I'm in Petaluma, California. I want to sincerely express my appreciation to all of you and the expertise that you bring to this. I want to, especially Veronica Lewis's most recent comments. But I want to go back to what Director Galley said concerning shared housing. That's a special concern of mine because I believe that shared housing and community housing is actually 20% of the solution to the whole problem that you're discussing. I would draw your attention to the ICF workshop in California on March 16th, specifically about shared housing. Second, I'd also ask you to look at the National Shared Housing Resource Center, which is a facilitation organization. When you go there, you're going to find out that there are 17 California organizations that are already part of that process and part of that program. So those 17 are very important. There are literally hundreds of thousands, millions of empty bedrooms in California where seniors have empty bedrooms. We need to develop housing matching programs to match seniors with empty bedrooms, but that requires agencies to facilitate that. There's also a whole movement towards community housing and working with the homeless transitional things. I would draw your attention to Share Sonoma County and the multiple community houses that they've developed over the last several months. Amy Appleton developed that program. I was a member of that board for many years. And I would also request that in your next update to this plan, you link the seniors and the master plan on aging much more closely to the action plan on homelessness, because there are some real solutions to the upcoming wave of senior homelessness that we need to address. Thank you.
Thank you, Jerry. All right, next we have Ludmilla Bade. You may voice your comment.
Hello, yes, Ludmilla Bade here. I am a community member, and I'm also on the Cal ICH Advisory Committee. I do want to speak to William McGee about education. Yes, I went to school in California, and I was homeless for almost 3 years. And what I want to say is the biggest things that I'm seeing missing from the school system are classes in how to function as a community building, nonviolent communication, specifically how to do talking circles, skills leading up to being able to mediation. How can we speak and function professionally, collaboratively, and also in peer support. I want to say those classes would help, if that's available, that would really help to reduce the amount of violence that people have. It would also help people to be able to function better in their housing situation in the future. And I would really love to see that at all levels of the schooling. Other educational things are CERT training available from the federal level. I was trained in CERT in emergency community response, and that was one of the things that really saved me when I had to move out onto the street. I was able to prepare and have the things I needed to survive, and that would help many other people. It also would help us with skills with fire suppression and prevention, earthquake survival, and lots of other things that are needed for survival in encampments or on the street. I have more to say, but that's all I have time for. Thank you.
Thank you for your comment, Ludmilla. All right, next we have Patty Prunherber. You may voice your comment.
Thank you very much. Patty Prunhuber. I am the Director of Housing Advocacy at Justice in Aging, and I want to commend everyone for their great presentations, and particularly talking about the all-in plan. We have 3 recommendations for the Cal ICH. The importance of lifting up the issue of older adult homelessness cannot be overstated. We need to see homeless data by age and intersectionally. We're very heartened that HUD is now going to gather more age granular data in the point in time count, including people 55 and over. We think it will bring to light the real crisis in older adult homelessness. And we know that the strategies and concerns of older adults can only be addressed if we have targeted programs. The second is I would like Cal ICH to make one of the focus areas of their strategic plan be older adults. Given the rise in older adult homelessness in California, that's essential. And finally, to move forward on the Master Plan for Aging 23-24 housing related initiative to set up a working group to explore and analyze existing local pilot rental assistance programs. That's initiative number 2. And this matches SB 37 authored by Senator Caballero, which would create a rental assistance program, a competitive grant program for localities targeted to older adults and people with disabilities who are at imminent risk of homelessness. So with these 3 areas, we think that Cal ICH can really address the issue of older adult homelessness. And thank you for your time.
Right, thank you, Patty. And our last comment is from Kim Lewis. Kim, you may voice your comment.
Yeah, good afternoon. Thank you, Kim Lewis, representing the California Coalition for Youth. And I want to appreciate the conversation today and your statewide assessment report and elevating the needs of our young people experiencing homelessness, and wanted to kind of come back to the comments around the upstream causes of homelessness and where we see prevalence data around young people and where their first episodes of homelessness were when they become chronically homeless adults. 50% of young people in some instances reported their first experience of homelessness when they were under 25 later on in life. And so I think if we really want to get at addressing the growing homelessness population, we really have to continue to increase our investment of our young people, and we can have better accountability around this. And I think that also means that the investments have to be meaningful investments, and that where some of these formula driven numbers lead to really minimal investments in some of our rural communities, $30,000 for the youth set aside in some places. It's really hard to really run a program in a community at a $30,000 level over a multi-year investment. And so I really would love for us to think about not penalizing folks, as was talked about, as when counts go down, you're going to lose dollars through these formulas. So we really have to re-envision some of this, and being mindful too that different programs have different definitions of eligibility. And so while the feds have many programs around McKinney-Vento, RHYA, the Runaway and Homeless Youth Act, and even under HUD using different definitions when it comes to our young people, we know in the state we can be as broad as possible to capture our young people who are couch surfing or doubled up, because we have different experiences in different communities. In rural, we tend to have more couch surfing, in other places, and even in our urban communities where young people are hidden in those communities. So have a lot of recommendations for the group, and I've sent those in, and would look forward to continuing the conversations about supporting our young people so they don't end up becoming homeless when they're adults. Thank you.
Thank you for your comment, Kim. All right, seeing no more hands raised, we will end public comment, and I'll turn it back to our co-chairs for their final remarks. We'll start with Secretary Pastor Ramirez.
Thank you, Giselle. And let's just want to thank both Giselle and Cody. Excellent facilitation. We're ending on time. It's just a few minutes before 4 o'clock. To our council members, thank you so much for the rich conversation, and advisory committee members that were able to join us. Really appreciate the feedback, the engagement, the critical thinking also that's going into how we continue to move together, both in terms of implementing the action plan, but also, of course, in terms of how we continue to make investments together that lead to more people being connected to housing and services. And as we began also sort of the conversation, the importance of looking at inflow. And I was really struck by the slide that Helene presented that shows the number of people that have been housed or have been connected, and then the number of people that are coming into the homelessness response system. And I hear that all the time. I was in San Diego a few months ago. I saw the data in San Diego, 13,000, just over 13,000 people being housed in 2022, and 15,000 people coming into the homelessness response system. So we have to do more on the prevention side. I think it's very clear. Thank you to our presenters today, to the Turner Center, to USICH. As Cody mentioned, that today's agenda, everything is connected, right? We have to use data to inform the work that we're doing. We have to be critical and constructively, right, in terms of examining where we are making progress and where we need to do more. And as my colleague, my co-chair, and I'll turn it over to him, said, we also have to be very open to driving the accountability conversation with, really starting at our levels, right? Starting at the council level. What more can we do to hold ourselves accountable for the programs that we administer and deliver? Where do we see opportunities to, as Veronica mentioned, to be more to remove redundancies, to remove barriers that make it very difficult to deliver our programs. So there's more work that needs to be done at our level. And, we're having the conversations that need to be had. And so as we drive accountability, the accountability conversation, I'm really looking forward to continuing to hear from the advisory committee and from members of our council in terms of how we ensure that the accountability component that is tied to the investments that we're delivering is a more sort of holistic conversation, right? That is framed in understanding the systems really across the board. And so that's the richness of the conversation that we had today, that we do have accountability metrics within the action plan that need to be refined, that there's opportunity for us to be able to do more, and that we need to continue to move with a sense of urgency. And so with that, I'll turn it over to Secretary Galley. It's always difficult to close a meeting that is filled with such rich conversation, but Secretary Galley, you can close us out.
There's the pressure, Lourdes. Close it out effectively. I guess a couple of final comments. Really appreciate the presentations, like you said, and the really great engaged conversation. Some follow-up for sure across a number of the presentations today. A couple of other final comments sorry, being interrupted very quickly. The idea that we work across all of state government on accountability, I think really matters. And I just want to close with one really important point about something I think that happened because of the work of this council in a much more seamless way than it would have otherwise happened. I think since our last meeting, we experienced some terrible winter storms. And as part of the OES organization and response across the state, we created a priority populations task force to address issues of populations who may experience the impact of the storms very differently, including those experiencing homelessness. And I just wanted to call out, shout out to Nancy and team at OES, to Corinne and Dakshika and others who really brought that task force together in a very meaningful way. And so even though we meet quarterly together and we do these very thoughtful conversations with lots of important follow-up, I think that effort only becomes real and easy because of the work that we're doing together, that doesn't just come every quarter in the 3-hour meetings that we have, that I appreciate Cody and Giselle facilitating and making happen. But I think it just demonstrates the strong working relationships that we depend on and bring together to make the work happen with our local partners at a local level. So really just grateful for that work and the work of those who make today's meeting happen, and look forward to seeing you in a few months. Thanks.
Wonderful. Well, thank you all again for joining our meeting today. With that, this meeting is adjourned at 4:06 p.m. As always, our meeting materials are available on our council meetings webpage. To receive up-to-date information on council's activities, please sign up on our email list. There's also a sign-up option on the CaliCH webpage. We also encourage you to follow CaliCH on social media platforms, and we hope to see you all at the next meeting on May 31st, 2023. Have a good afternoon.